Howdy, friends. Welcome to the Local Matters podcast, where we make the federal government irrelevant again. I had a great time last week talking with you guys about a lot of the judicial candidates that were up in the state of Texas, because, again, provincial governments mean the most, and provincial courts mean the most. And I think that's relevant concerning right now, for those of you who are listening live. We are in the middle of hearings for one of the Supreme Court justices of the United States. It was very helpful to talk about why it matters more who we have on our local provincial governments. We got a little bit of a taste of what it looks like to have different Supreme Courts, what they do in the state of Texas, why our Texas court system is set up the way it is, and why it's important to vote at your local levels for your local judges. There was a great podcast, but what everyone complained about was the guest. Everyone said that James guy, he's weird, he's loud, he's boisterous, and I don't like him very much. So I said, all right, I promise I will get a better guest. Well, friends, I have delivered on that promise. I have with me the wonderful, the smart, the intelligent, and most importantly, the personal friend of mine, Miss Jordan Hormann. Welcome to the podcast.
Hi, thanks for having me.
All right. So, Jordan, we're going to talk a little bit about why you're here, moving forward. But I think it's important that everybody knows exactly who you are, and kind of what you do, what your story is. So I'm going to give you a couple of minutes just to sort of say whatever you feel is necessary to say about yourself and what you do, what you like, what you dislike, right? Why you've chosen to show up on this humble couch with me. So I'll give you a couple of minutes to do that. Go ahead and take it away, and we'll get started talking about this stuff.
Okay, sounds good. So yeah, my name's Jordan. Can I still say I'm new to Texas?
That's
2 years.
I'm actually going to ask. I wanted to ask you about that. So you've been in Texas 2 years. Before that, you lived in North Texas, what most people are calling Oklahoma or Indian Texas.
Indian Texas.
But that's where you've lived. Your family lives in Seattle, correct?
They live north of Seattle.
Okay.
But yeah, I mean, they're from They live in Washington.
And are you also from Washington?
I am not from Washington. I have only lived in Oklahoma. Well, that's not true. I was born here in Texas.
Good.
But spent the majority of my life in Oklahoma. We were a military family, so that's why we were there.
All right.
And then my family made the very poor decision to move to Washington. And they sure regret that.
They sure regret
that. But yeah, so I moved from Oklahoma down here to Texas 2 years ago. And we love it. We love it here. Very happy.
Good stuff. So, you yourself have never lived in Washington.
I have not. I have visited, and that's plenty for me.
So why? And this is actually relevant to what we're talking about here, because we're talking about why province, or why your state matters, why your local municipalities matter. Why are your parents now? I can confirm, right? Because again, I helped facilitate the purchase of your parents' home here in Texas, which they'll be moving to in a few years, right? So they are planning on getting out of there. Why are they not happy? What do they not like about Washington?
What is there to like?
It's beautiful.
Beautiful.
Washington's a beautiful state.
No, Washington is gorgeous. It's great to visit. If you don't mind the rain and the unhappy people, then you might as well live there. But
the unhappy people.
No, there's just, my parents do not fit in with the Washingtoners, the Washingtonians,
that's what we're thinking.
The Seattleites, those people, they don't like them. They don't dislike them. What's really probably more accurate is that the Washingtonians, I don't know, them, the people who live in Washington are not a huge fan of the type of people that my family.
The type of people that your family
are. There's just, they and their values don't match up with those of the people who live in Washington. They are pretty fundamentally different on a lot of things, and they have decided that they miss the Midwest, the South, if you will, and are really looking forward to moving back here. They loved Oklahoma. It's just got a little hot. But they've decided that it's better to be hot.
It's better to weather the heat.
It's better to be hot than miserable in Washington.
They can take the heat, so they're getting out of the kitchen. Yeah.
Thanks to you and helping them get at home, they'll be moving here in 3 years.
Super excited about that.
So excited about that. It'd be great to have my family.
Yeah.
Back around.
So that's an interesting thing. So your family is basically voting with their feet, right? They
100%.
One of the great things about living in this country is the fact that if you don't like the area that you live in,
there are 49 other states if you're not happy in the one you're in.
You can get up and go wherever it is you want to go, where your local provincial governments meet your needs and they service your values.
Yep.
And that's a great thing about this country. That's one thing that I love about it. And again, one of the reasons why I do this podcast is because that is so neglected. We spend so much time thinking about the government as a whole that we neglect to think, wait, if I really want to change my life, right, I need to focus on the people that are immediately affecting my life. And so many of us don't even know who those people are, that we're so focused on the big shiny object up over in Washington with all that bright orange hair. We're so focused on that we don't say, wait a minute, what about my state? What is it about my state that I like or don't like? Am I prepared to leave my state? Am I prepared to change my state? Maybe I want to stay and I want to change things. That's really ultimately what matters. And I think your parents are a great example of that. So I kind of veered off there because I wanted to get to that. I wanted to demonstrate that because I think that's a good case study on what we're talking about. But you here live in Texas. What do you do?
I am an ICU nurse.
Okay.
I have been an ICU nurse for almost 4 years. I worked in Oklahoma before moving here. And
are you comfortable saying where you're an ICU nurse?
Yeah, sure. I work at Baylor University Medical Center in downtown Dallas.
Okay.
I've been there for about 1.5 years, and before that I worked at Parkland. I've seen a lot of sick people, and I'm taking care of a lot of different type of people. Especially going from Parkland to Baylor is just a different population. But yeah, I love nursing. I love ICU nursing specifically. I think I'd probably change careers before I changed, completely change careers and not be in healthcare before I decided not to do something ICU.
Okay. Very nice.
I'd be a great accountant.
Yeah, you'd be, you would. You've got, I know you really well. You've got that kind of a mind. Everything's got to be in order, which I understand. My wife is a nurse. And for those of you that are going to ask, why are you neglecting your wife? Why is your wife not here? My wife's a pediatric nurse. She works with children. And what I want to talk with you today, and we'll get into this in just a second, is COVID-19 and what how that's changed our lives and what our local governments can do in order to help with that, and what we should do, what we know, what we don't know. And the fact is that my wife, while she's brilliant, she's very good at her job, she works with kids. And one of the things that we know about COVID-19 is that it doesn't affect kids the way it affects adults. There are not nearly as many COVID patients that go onto her unit. And so she doesn't have the level of experience on the ground that you do working with adults with COVID-19. And so that's why I have her on instead of my lovely wife. My wife will be on one of these shows at some point. I promise. I love her, and I can't wait for all of you guys to get to be introduced to her. But I really wanted to have Jordan on for that specific reason, because this is a big thing that's affecting our lives, not just on a national level, but on a local level. And I want to break that down. Before we do that, let me ask this. Now I know this information fairly well because I live with one. But what is the daily life of a nurse look like? Right. So an ICU nurse, you wake up in the morning, you get your pumpkin spice latte. Right, you go to, or your what is it, latte with 2 pumps of pumpkin, and so she basically orders a pumpkin spice latte, but she says it differently. So
I cut out some of that unnecessary sugar,
so she doesn't get judged.
Just enough gone to make me not a diabetic.
Oh my gosh, man! I ordered a flat white the other day, and I felt really uncomfortable with myself. I am a black coffee. I've got my black coffee in my princess cup right here. It's fantastic. But you wake up in the morning, you get your coffee, you get ready for your day, you walk through the hospital doors. What does your day consist of? What does your life look like?
Well, in the ICU, I guess it's pretty busy. I mean, all nursing is busy, but this is specifically, I take care of 1 to 2 patients maximum, and they are the sickest that they can get. It's lots of giving meds, collaborating with doctors, collaborating with the other members of the multidisciplinary team, whether that be physical therapy, occupational therapy, speech therapy, nutrition. Basically, as a nurse, I'm the middleman for all of that, coordinating all of that, making sure that labs get drawn appropriately, that things that are ordered for the right patient, questioning, do we need things, bringing things to a provider, whether that be a nurse practitioner or a doctor, bringing something to their attention. There's a lot of misconception that as a nurse, I'm only following orders, but there's a lot of things that a provider would not know if I didn't tell them. We have rounds in the morning, and I'm the first person who has assessed that patient for the day. I've gone through all the orders. I know what the holes are. And when the providers develop a plan for the patient, the nurse is a crucial part in developing that plan. Okay. Because we know that patient intimately.
Yeah. I've heard people say that a nurse is like, it's like when you're a patient, your nurse is your agent, right? Yeah. Your nurse is the one that's going in there and advocating, saying this is what they need, right? Because doctors, they've got the obviously they take on the professional liability. They have a certain level of knowledge and understanding of medicine in general. But ultimately the nurse is the one that's in there, and they know the patient. Yes. So they're the one to kind of translate. This is how the doctors, or like you said, the multidisciplinary, I don't know what you said, multidisciplinary team, right?
Yeah.
So the doctors, they have these specialties, and the nurse comes in and says, this is how you can use that specialty to better help this patient.
Yeah.
Right. So you're their advocate.
Absolutely. Especially now in the middle of COVID, if more than anything, because patients' family members are not at bedside, and your family member is the one that knows you the best, and they're not there. So the nurse has to fill that role and kind of facilitate that in a different way than we've had to before.
So is that the biggest change with COVID right now? Like when your world, I mean, I would think it's fair to assume your world got turned upside down when this started happening.
Yeah, absolutely.
Is that the biggest change? Is the lack of the family at the bedside?
I would say that's definitely a big part of it. My day-to-day life did change a little bit without the family members there, but I mean, there are definitely times when, there aren't family members there for somebody who isn't a COVID patient. I would say with this, the biggest thing that flipped everything upside down is the fact that we don't know a lot about it. We don't know the long-term repercussions. And when COVID initially hit, we had to change everything about our workflow and try and manage this patient that we did not know how they were going to progress. Okay. And I think that's probably been the biggest thing. Now, long-term, not having family members there has been awful for a lot of reasons.
Yeah. I mean, like what kind of issues does that bring?
So the unit that I don't technically work on the, quote, COVID unit. That's a different unit, but I have exclusively been taking care of COVID patients since April. Because
so is that just because it's overflow? Like the COVID unit can't handle the number of
So the patients that I get are the sickest of the sick COVID patients. They are inches from death. I am trained on a support device called ECMO. Basically, it takes the blood from your body, oxygenates it, and pumps it back in.
I know this one. This ECMO, that is the highest form of life support that you have available, right?
It is. That is it. If that is not work, then
that is 100% of my medical knowledge that I'll be bringing to this conversation.
So that's our unit is the only unit in the hospital that does that, and so we have taken ECMO patients from other hospitals in the area, not just our own hospital. We've taken ECMO patients from Louisiana, a couple of them have all come in, and so that's my experience with COVID is the sickest of the sick patient. And I've honestly forgotten the question that you asked me.
Well, I was just saying how did the change of not having people at the bedside, having family at the bedside, what kind of complications does that bring?
Okay, so for us, we've had a lot of patients that have been previously an ECMO stay would be like 2 weeks, 3 weeks, maybe maximum. And at that point, if we hadn't seen progress, if we hadn't been able to come down on the amount of support that they were getting, that would be a discussion with the family on like, what are our goals of care here? But because we don't know about COVID, we've given people a lot longer. Additionally, though, without family members at bedside, they cannot see and interact with their family member. So their perception of what's going on and their progress isn't as tangible. They can't see the struggles and the progress and really be able to determine, is this something that my family member would want? Is this something that, we should keep doing? Because they can't see it. The extent of our interactions with families until we're at an end of life point and we need to start having those conversations is purely through over the phone or FaceTime.
Okay.
That's how family members get to see their loved one right now.
And there's obviously severe limitations to that, right?
Oh gosh, yeah. We've got one iPad on the unit that one of our doctors donated, and that's how the entirety of our 10 ECMO patients, we have to divvy that out throughout the day and talk to their families and coordinate and Wi-Fi issues and, timing. And it's caused a lot of, we're grateful that we have that technology available to be able to do that, because I cannot imagine having my loved one be in a room somewhere in a hospital and I have not seen them in months. But at the same time, it obviously has its limitations.
Yeah. You're talking about ECMO. And one of the things that you said that I really want to kind of poke at a little bit is that if this can't work, they're done, right? If this can't work, then
that's the end of the options.
That's the end of our options, right? So that puts you in a unique situation, because I would assume, and again, if I'm totally misrepresenting how the hospital system works, I would assume that basically if a patient gets sicker, they get kicked to a different unit. And they just kind of go up and up and up and up until they finally and eventually end up at you. And once they get to you, there's really nowhere else to go.
Correct.
So that puts you in a position of having to deal with some really intense stuff. And I mean, again, I don't want to dig into this, right? Because it's probably, but that's got to be crazy emotional for the nurses involved.
Yeah, it for sure has been. Like I said, I've been an ICU nurse for 4 years, and grief and death and heartache are not foreign concepts to me, but I have never experienced the volume and the circumstances like this has presented. It has, and then additionally, when you're only taking care of this certain type of patient and these certain circumstances day after day, like I said, we can get 1 to 2 patients, but when they're on ECMO, it's just 1 patient. So I know so much about these people from their family members. Yeah. I know their life stories. I know how they met. I know, their likes and dislikes and who at home is missing them and all of that. And it's just been a different kind of grief from family members, especially because for a lot of them, they were not at the end of their life. I've had many middle-aged patients, obviously some older patients too, of course, but many middle-aged patients that would have probably lived another 10, 20 plus years, and this hit them out of nowhere.
And these are COVID patients?
These are COVID patients.
Okay.
And nobody was prepared for it.
Yeah. So what is the percentage, would you say, of people on your unit that are suffering from COVID, or that COVID is a complicating factor in their situation? Because you said you got 10 ECMO patients.
So we have 10 ECMO patients. That's pretty much, so our unit is a 34-bed unit. We also do heart surgeries and transplants and those types of things. So those patients are obviously not affected by COVID. The only COVID patients that we're really getting are these ECMO patients that have exhausted all other therapies and are now here with us, or they were on ECMO and now have progressed and they're not on ECMO, and we're just keeping a really close eye on them and want to keep them on our unit. So, I mean, I guess percentage-wise, I don't know, what's 10 out of 34, like a third?
Yeah, so about
a little over a third, but we do have an entire other unit in the hospital that at one point was 100% an ECMO ICU. Okay. Or not ECMO ICU, excuse me, a COVID ICU.
COVID ICU.
Yeah.
Okay. And so we hear a lot of talk, right, about on the national level about hospitals being overwhelmed, that they can't handle the amount of, this is where the whole flatten the curve thing came in,
right,
trying to keep the hospitals from getting overwhelmed. Now, obviously, life has become a lot more busy for you. And things have changed. But at any point in your career, did you ever feel like you were working in a situation where you guys were overwhelmed? You couldn't handle the number of people that were coming in from COVID-19?
Yeah.
Okay.
Yes. Like I said, our unit only took a certain population of that. But initially, we went from, I think, the first patient in the DFW area. I think maybe it was the first one in all of Texas. I can't remember exactly. It's really all just blended together at this point. That first patient was diagnosed, and they converted what is our medicine ICU to the COVID ICU in a matter of hours. They had to completely rearrange the way the unit worked, make more negative pressure rooms, find PPE, find all of these things to completely change what was just an ICU to be able to accommodate these patients. And for a good probably 2 or 3 months, it was full to the max. We were floating every nurse that we had available to that unit to be able to take care of them. It's definitely dwindled. I mean, I think the goal of flattening the curve worked.
Yeah, that was going to be my next question is, do you feel like we're coming to the other side of this?
I do. Now, what our unit is experiencing is a little bit different because we have a smaller population and we're only taking a certain type of patient. But I mean, our medicine ICU now is only a small portion of it is considered like the COVID dirty side. We've definitely, the amount of patients that we've had has drastically decreased, which is good, because we were for a while, I think, pretty overwhelmed.
Yeah. So what do we know about this? Because what it seems to me is that you're talking about, when you're telling that story, it seems like a lot of this is just, we don't know enough about the coronavirus, right? Or the COVID-19. I don't even know what this thing is called, to be honest. I'm hearing coronavirus, I'm hearing COVID-19, I'm hearing, all sorts of different, different things that this thing is being called. I don't know. So, James and I just called it the Rona.
The Rona. We all have some pet names for
exactly.
it.
So but it seems like a lot of what you just described is not necessarily, and you did say that the beds were full, right? So there is obviously a high volume of patients that are coming in, which we expected, but it seems like a big thing was we didn't know what this was. We're going to have to convert the rooms to what you said, negative pressure, which, correct me if I'm wrong, but that means the air flows in, the air doesn't flow out.
Yes, exactly.
Okay.
So when you open the door, you're not spurting particles out into the hallway.
Okay.
It's only sucking in.
Yeah. So a lot of it is just we have to convert the hospital wing to anticipate things that we don't understand.
Yes.
Right. So it's not just the matter of there's a bunch of new patients. It's also the fact that we don't understand what this is or how to operate with it. So at this point, right, what you say, you do think we are coming to the other side of it, which is awesome news. What do we understand about this virus?
So we know a little more than we did, but there's still a lot out there you're getting conflicting evidence from people. And rightfully so. I mean, coronavirus has been around for years and years and years, decades, I don't know exactly how long, but there are all these different strands of coronavirus. So this one now that we're dealing with is COVID-19. That's what's like, it is a coronavirus, but it is a specific strain. So what we know about it now is that it's probably spread by droplets. Now I have not read the most recent CDC discussions on it because they've gone back and forth 100 times, and now I'm just trying to do my job, take care of people and just do what the hospital tells me. But we do think it's probably spread by droplets. However, there are certain situations where it could become aerosolized. If you were to be coughing incessantly kind of thing, you're using more force to push it out. Now it's aerosolized.
So aerosolized means it's in the air.
It's in the air. It's gonna hang around longer. Where the flu is a droplet. Okay. You have to be in a closer contact to it. It's not gonna have as much of a spread when it lands on surfaces. It will still be there. Yeah. So it's probably how it's spread. There are definitely things that you can do to help prevent the spread, which we've kind of, we've all gone back and forth on, what the right thing to do is out in public. But simple things like covering your cough, wearing a mask, washing your hands. Please, for the love of God, wash your hands. If you're feeling sick, avoid being around people. I mean, that's common sense. If you have the flu, if you have a cold, please, I don't want your cold. Yeah. It's nothing really any more than any other virus. Now, that being said, it is the majority of people who get COVID-19 are okay. But there are a lot of people, and I can attest to this, who are not. And it's horrible and tragic and dramatic. And if they hadn't gotten this, they would have lived. Okay. You know, and we still don't know a lot. We still don't know what the best treatment is. You know, they've thrown around all these different drugs on TV. You've heard about remdesivir. You've heard about convalescent plasma. You've heard about Plaquenil, whatever. You know, there's all these trials going around. It's going to be years until we know how to actually treat this virus, if we can.
Yeah.
So, I mean, I think the best thing that we can do, knowing what we know now a little bit, is to just practice, you know, common courtesy. And if you feel sick, don't be around people.
Yeah.
And avoid being around a lot of people if you don't have to be.
One of the biggest things that my wife said about the coronavirus, she says one of the greatest blessings is people are washing their hands.
Gosh,
now.
please.
Because so many people didn't wash their hands.
Not even just for COVID. Like, it's just gross.
Yeah, for sure. But I mean, that's the thing, is not even COVID, but we're about to head into flu season.
Yeah. Oh gosh, please, y'all get your flu shots.
And that's the thing.
We can't do both.
Like
we can do one or the other. We can't do both right now.
Like I told him, so like Michelle was saying, she says, you know, her now they did have COVID patients on her unit, but remember, she works in pediatrics, and kids are just not getting affected like this the way adults are.
And I would imagine, I mean, you can correct me if I'm wrong, but they're usually not there. They just also have COVID, right? Like, they weren't there because of COVID. They also have.
I think she's told me about one patient that she's seen that is there because of COVID-19. Right. And for what it's worth, that patient is now fine. Right. They got up onto a ventilator and then they got off. And so, you know, the kids just aren't being affected by this, but not. They are bracing for impact with this flu season. Yeah. Because they're anticipating a nasty one, especially with this, you know, this concept of we're already overwhelmed with COVID-19, right? We don't know what that's going to do to how the medical industry is prepared to handle a particularly heavy flu season. Which, again, there's no evidence that this flu season is going to be particularly heavy from a biological standpoint. But again, if we don't have the infrastructure in place, we don't know what that means. And so they are hunkered down. They are ready to go, because I will tell you, coronavirus won't get your kids. The flu will absolutely get your kids. Yes. Right. So you want to make sure that you're getting vaccinated for the flu. I do want to kind of tangent off into something else, because you obviously have an opinion of the fact that the coronavirus is a bad thing, right? And it is something that we need to be cautious about, and that we need to approach on. How do you feel about people? So, like, if you're walking around and you see somebody not wearing a mask, right? How does that? I mean, from your perspective, how do you feel about those people, or what do you think about those people? I suppose, about their point of view.
While I respect their right to not wear a mask, I do not think that wearing a mask is an infringement on their rights. I think that they should be, whether or not the government tells you to, whether or not I tell you to as a healthcare provider. I think that wearing a mask is common courtesy. COVID or not, I mean, if you're sick, please, like, wear a mask. But, you know, so much we're talking about COVID-19 right now. I mean, when you think about, kids aren't getting affected. Yes, the majority of people who are infected with COVID-19 recover fine, that we know of right now. I do want to point out that we do not know the long-term implications of this disease and how it will affect all of your major organ systems. We do not know. Whether or not people, though, are recovering, there are still so many people that have died. And I know people are like, oh, they have pre-existing conditions. Okay, well, let's talk about that. 15% of Texans have diabetes. 15%. 35%.
And they're all in Houston.
Yeah.
I'd like to point that.
I looked this up. 35% of Texans are obese. That is a pre-existing condition. That is a comorbidity. That is something that people are like, oh, well, only people who have health problems. Those are health problems. 30% of you are fat. Like, that's a health problem. Okay. Yeah. Let's stop pretending that it's just people with
That's just spoken. That's the way I love. The one thing I love about healthcare providers is that they just they don't have any qualms about saying stuff like that. You're like, you're really fat, and
You
those,
might be a great person. I don't care, but you're still
and
you're fat. That's
those moles
fine.
are looking
If you're
kind of
okay
weird
with
while
that,
we're at it, right?
you should get that looked at. No, I mean, but that's the reality of it. We're not talking just about people who are in heart failure or who have COPD or who have, X, Y, or Z disease. The people that we're seeing getting sick, a lot of them don't have those diseases. A lot of what I've seen are people who have diabetes, are obese, and, are smokers or some of those other things that are considered comorbidities. And that's what people love to toss around is, oh, well, the people who are dying are the people who are already sick. No, that obese person with diabetes probably would have lived another 20 years. Yeah. So use your common courtesy and protect those people around you. I mean, it doesn't do anything to you to wear a mask. Now, if you don't want to, fine. I'm not going to harp on you about it. I think you should, and I think you should because you care about your neighbor and you care about those people that you don't know about. I mean, not even just that. I mean, it's not just old people, it's young people. I've seen so many young people with young children who maybe had a comorbidity, some who didn't, and now their children are left without a parent. Their spouse is left without their partner, and on top of that, there's probably up there in the millions of dollars of healthcare bills. And I know, as not even just as a nurse, as a person, that if I knew that I had given this to somebody, could I live with myself with that? I can't even imagine the amount of guilt I would have for knowing that I caused that on somebody else. And I just think that's what people should be doing, is because they care about the other people around them.
So what should people be doing with their mask? Because I mean, I remember, I know that a lot of healthcare professionals have to go through mask training, where you have to know, like, you have to be shown or, taught kind of how. Is that a real thing?
No,
am I totally lying about that?
If you're wearing a simple face mask, no. I mean, what is recommended for people out in public to be wearing, you don't necessarily need an N95. Now, I said that we don't really know the transmission of it. Is it droplet? Is it airborne? Is it... What the evidence is probably pointing to is it's probably more droplet, and me wearing a mask and you wearing a mask is probably going to be enough that if one of us had it, I'm not going to spread it to you. Let's say I had it. I'm not going to spread it to you because I'm wearing a mask. But even if it could have gotten out there because it's airborne, maybe the chance of you getting it because you are also wearing a mask is much smaller. That being said, I know there was a lot of what you're talking about would be an N95, and yes, you are correct. An N95 has to be fitted for you. I mean, we go through a bunch of testing where they put all these masks on you. There's 10 different types, and they run a filter test, and I have to do this thing where I read a paragraph while wearing the mask, and it tests the seal. I have to nod up and down and shake my head side to side and do all these things to make sure that the seal is properly fitted. If it's not, then it's worthless. Okay. It does you no good to wear an N95 that you were not fit tested for.
So is that not the case, though, with these cloth masks that we see walking around, right? If you're saying that the N95, it's not properly fitted, is worthless, wouldn't that also kind of extend to people who are just wearing cloth masks that aren't fitted for them, right? They probably knit them at their home or something like that. I mean, is that equally not worthless?
I mean, I don't know. I think that wearing anything, okay, I guess I won't say that the N95 is worthless, but for what you're using it for, you might as well just be wearing a cloth mask or a disposable mask or something like that. There's no evidence that shows currently that wearing it one way or the other is wearing an N95 or wearing a face mask really is going to play a big role. That now my concern with telling you to wear a face mask versus an N95 is because the people who are at risk of getting COVID-19 from an aerosolized thing are healthcare providers.
Okay.
You as a layperson, if everybody is out there wearing a mask and everybody is out there practicing social distancing and avoiding large crowds if they don't have to, washing their hands, doing all the things, there aren't a lot of like aerosolizing things happening. Whereas in the hospital, if you're on a ventilator, that's aerosolized. If your ventilator pops off, that's aerosolized. If you're on a BiPAP or, a high flow nasal cannula, these are just different types of ways to get oxygen to patients. All of those types of things aerosolize the particles or the virus and put it in the air, which now puts us more at risk because it's traveling further, right? So what is recommended now is to wear a face mask. The evidence shows that's probably enough. Now, I know that doesn't sound like really great and reassuring. The evidence probably shows that, but I mean, that's what we know. And that's what I would recommend is an N95 is expensive. If you're using it because you think you're at greater risk, if it's not fitted for you, it doesn't matter. And PPE is is still needed for healthcare providers. Right. So that's my take on it. I know it's a little convoluted, but
well, I wanted to just kind of point that out because you, I think, have a unique perspective in the sense that I know you very well, and I know that you have your opinions about things like business and entrepreneurship, and your husband is works for a large architectural firm, and so you're very pro people being able to go out and live their lives and things like that. And so, I'm just saying you really don't have a political interest in saying this kind of stuff. You just, the facts on the ground, right? And you've lived that and you've seen that. And I wanted to kind of get that perspective from you. Because it's clear that this is something that whether it's as dangerous as people are saying it is or not, it is something we need to think about, and it's something that we need to consider, and it's something that we need to not just flippantly throw away. And so I like that you brought that perspective to it. But I wanted to go back to something that you said, way before. There's been a lot of information coming out of you, which is good. It's great stuff. But
you get me going.
You talked earlier, and again, no, but you were about to go on a rant, and you didn't, and now I want you to. Okay. So you talked about the CDC, right? You say the CDC has all these different changing things, and you just want to do your job, right?
Yeah.
These different recommendations and stuff like that. Do you think that's a problem? I mean, so what I'm saying here is this. Do you think that the solution for COVID-19 is going to come from the top down? Do you think that federal policy, now mind you, you can answer however you want, but you are on a podcast called Local Matters, right? So wink, wink, nudge, nudge. But no, you again, answer however you want. But do you think that federal policy is going to in any way influence the numbers on COVID-19 or not?
No. Now, I don't know that I have a great reason why I think that. I think that is more like just a gut feeling and from able to take what we've seen in the last 6 months or so. I think every state, though, has its own issues, right? Wyoming, there's like 10 people that live in Wyoming and like 500 cows, like 5,000 cows.
Three of them are my family. Three of those people are my family.
There's all these people in Wyoming, right? Do they need to be wearing masks wherever they go? Probably not. I don't think there are a lot of Wyomingers.
Wyomites.
People from Wyoming who are like going out and being in big crowds because, I mean, as far as we know, cows are not spreading COVID-19. So does it really make sense for the federal government to just like create, I mean, I'm assuming you're asking me about just like a mask mandate across the board kind of thing. Do I think that that's necessary? No. I also, though, am very pro states doing what they think is best for their people. Okay. And I don't think that that's within the scope of the federal government to enact this like overwhelming mask mandate. I do think that it's up to the state and maybe even the city, because I mean, like, I don't know how many people live in the DFW area. A lot, but I mean,
it's over 1 million.
Okay, over 1 million. Are there that many people living in Anna Like, no.
Not really.
Are there that many people living in, I don't know that my Texas geography that well. I'm not going to
Lukenbach.
lie.
A lot of people in Lukenbach.
Right?
Yeah.
Fredericksburg, I've been there. Like,
Yeah.
are there as many people that what we decide here in the DFW area needs to apply to the rest of these like rural towns?
Yeah.
No, I don't know. But at the same time, I mean, I don't know. I just want you to wear a mask because you're a good person. Like,
I was up in.
Just care about people.
I was up in Wyoming for my nephew's first birthday party here recently, and that was one of the craziest things. We went to a grocery store, and I brought my mask, and everybody looked at me like I was crazy. I was the crazy one for wearing a mask. Nobody,
city boy wearing a mask.
Nobody in Cheyenne, we were in Cheyenne. Nobody in Cheyenne, Wyoming wears a mask. That's not true. There are some people.
Because the people from Cheyenne, Wyoming have not left Cheyenne, Wyoming.
That is
maybe
likely the case.
Since before this happened. So, and you're the anomaly going to visit Cheyenne, Wyoming.
That
so
is likely
maybe
the case.
I don't know.
But nobody, like there's just not a lot of people wearing a mask in those areas. But the thing is that, so it's not within the scope of the federal government to do that. Do you think it would help? Right? Do you think if all of a sudden Joe Biden gets elected or Donald Trump gets elected and they say everybody's not wearing a mask, do you think that we would see any sort of, and of course we're dealing in theoreticals here,
sure,
right? So you can give an answer that by all means could be wrong, could be right, but nobody can know. So do you think that we would see any sort of decrease in the number of COVID patients through a national mask mandate?
Now, no.
Okay.
5 months ago, maybe. I mean, even just here in Texas, I know that it wasn't wearing, I lived downtown, up until recently, and I don't think it was until May, maybe, when people started, when the reopening happened, the people who were out were wearing masks. Because now that I think about it, there was so much we didn't know, and we didn't know what would really help, that I don't really remember, even as a healthcare provider or professional. I guess I'm not a provider, a healthcare professional. Excuse me.
We really care about these semantic arguments.
Well, I do. I am in nurse practitioner school. I am not a provider yet. I don't remember wearing a mask out in public until probably at least a month into this, when we were like, oh man, maybe we should be. And that maybe if we all had been, everything was shut down, but people were still going to the grocery store. People were still out and about, it was definitely at a less smaller quantity of people out and about, but we were. I don't really remember wearing a mask until probably, I want to say at least a month into all of this. And that maybe if we all had, and that if it had been public practice, because I don't think they started making the mask mandate until maybe a few weeks after the opening started. Or the reopening happened. I can't remember. I mean, I feel like there was a time period where it was.
There hasn't been a national mask mandate.
No, but here locally.
Yeah, so
Governor Abbott or whatever.
Yeah, Governor Abbott in Texas put that. Hayden, can you look up when that happened?
I can't remember
when Governor Abbott put down the mask mandate, and I think, as far as I know, the mask mandate is still going on in the state of Texas.
Yeah.
Now, local municipalities have basically said that they're not going to enforce a mask mandate, because just like the United States is a big country, Texas is a big state.
Yeah.
And like you said, people in Anna or people in, New Braunfels or somewhere like that, you're living a different life than people who are in the middle of downtown Austin, right?
Right.
So there are certain municipalities that have said that they're yes, Governor Abbott has put out this mask mandate, but we're not going to necessarily be hard-nosed enforcing that unless you work for a government office, right?
Yeah.
And
July
it was
2nd,
July
really?
2nd. That was really late.
Wow.
We were really late on the mask mandate in Texas. So
that's surprising. Okay, so now here's another point of that, though. I don't know that I necessarily support a governmental mask mandate, if that makes sense.
Well, that's interesting, because you just went on this big long thing about how devastating COVID can be.
COVID is awful.
Yeah.
It's terrible. This is like something we talk about at work all the time. It's just this like exclamation. It's just like, God, COVID sucks, because it does. But I think I support, what I more likely support is businesses making their own mandates of what they will allow, what they will require for you to come in. I mean, there are plenty of business, like restaurants, that you have to be wearing a jacket and a tie to come in and eat.
Yep.
So if a business wants to say, you have to wear a mask, then fine. That is their right to decide how they want their customers to enter the facility. I don't know. I have a lot of concern about personal freedoms, and now, do I think you should wear a mask? Yes, but not necessarily because the government told you to.
Very good.
I think you should because that's what a common decent person would do. I think you should because it's a matter of public health and public safety. But I don't know if I necessarily think that the government should be enforcing it.
Well, that's actually really interesting because I said,
I don't really know why.
I know
that's
you.
Just kind of what I feel.
I know you, and I know you really well, and I know that you have certain feelings about, and I don't want you to hide those feelings by all means, right? But I know that there's a great conflict within you because of these two sides of yourself, and we do need to discuss that. We are going to take a quick break though, and we will kind of dive right into that once we get back into this. All right. So we guys are going to take a real quick break, and I will see you on the other side of it. With Jordan Hormann. He's got a lot of great opinions on this sort of stuff. Very interesting person, and hopefully we'll get a little more interesting here in just a little bit. But I'll see you guys in just a second. Welcome back, everybody, to Local Matters Podcast. I am here with the illustrious, the often imitated, never duplicated, Jordan Hormann, who is here with me as my guest, local nurse here in the DFW area, talking with you about the effects of COVID on your life at a local level. Because of course, we are bottom of the ticket folks here at Local Matters, as you well know. We talk about a lot of national issues, but we're talking about how it affects you, how it affects your life. Because the reality is, no matter how many times the candidates look at the camera and say, how have I affected your life? The answer is probably not a whole lot, to be honest with you. We're going to talk about the people and things that do. So I'm here with Jordan. Jordan, I want to poke on something. So you were about to get onto your soapbox, and I was really excited about that when I cut you off, and I feel really bad. Before you do that, though, I do want to mention something because we talked about semantics earlier. You said that you're in nurse practitioner school. And again, I'm married to a nurse. I hear the term nurse practitioner all the time. They say you can go to the doctor or you can go to a nurse practitioner. What is that? What does that? Because it's confusing. It's like it's got nurse in the name, but you're kind of a doctor basically. I don't know. I don't really. So tell everyone what that is.
Okay, so I'm working on my master's in nursing right now to be an adult acute care nurse practitioner. So what that means is that I have a bachelor's degree in nursing. And I currently work as a registered nurse. But when I graduate, hopefully at some point in the future, I will work as a medical provider rather than as a nurse. So how nurse and nurse practitioner are different is nurses cannot write orders. They apply orders. So a nurse practitioner, I will work with other members of the healthcare team. Usually that means it's a doctor, to develop the medical plan and manage a patient. So that means I will order labs. I'll prescribe drugs. I will develop goals of care with the doctor and the patient and their family to create a healthcare plan. It's kind of hard to explain if you're not in healthcare and you don't see it. But it's like I'm going to offend a lot of doctors if they hear this. It's like a doctor, but I cannot there's certain things that I cannot do without training or sign off from a doctor. So my hope is not to work in an office. I will work in an ICU like I do now, but I will be the one writing the orders rather than the one acting them out.
So you're going to transition away from bedside, or do you want to still maintain a bedside presence as a nurse practitioner?
So as a nurse practitioner, I'll still be, I'm technically not at the bedside. However, I'm still actively assessing patients, working on a plan, talking with patients, talking with the nurses and the families. But I technically will not be at the bedside. I will, hopefully, my idea of what I will be doing as a nurse practitioner, because there's a lot of different things you can do. I'll still be working in an ICU. I will be doing procedures and ordering meds and those types of things. So it's technically not considered a bedside role. But I do think it's important to note that I think nurse practitioners and doctors are still at the bedside. They're just not as close to the bedside.
So I've heard a little urban myth, and I'm hoping you can shed light and say if this is really true. Now, mind you, I'm again, one of the most important local government officials are the local police, and I've heard something about being a nurse and interacting with police. Right, I've been told that if you're pulled over and you flash that little RN tag, that you are more likely to get off with a slap on the wrist or maybe get a warning.
Well,
is that true? And
I've never gotten a ticket.
You've never gotten a ticket?
I've only been pulled over once.
You've only been pulled over once?
Yeah, and I think I was like 16.
Gosh, I do not envy your childhood, man.
I've had
three.
That is I have never, as a nurse, I've never had the opportunity to try and use that advantage. I do know from family experiences that is true. I have some pretty good stories about that.
Like, give me one. Throw one out there.
So my mom is a nurse.
Your mom? Your mom's a wonderful
woman. My mom has been a psych nurse for over 20 years. How the heck she has the patience to do that, I do not know. I do not have that patience.
I've worked with her mother. She's a very patient woman.
Oh,
very patient.
I could not be a psych nurse. Anyway, that's beside the point. My mom's been a nurse for 20 years. She also drives like a maniac. It's been pulled over many times. So one time in particular, here's two. We'll give you two stories because they're good. Once she's driving down the highway in Oklahoma. This is in Oklahoma, and she works at a hospital downtown. And she is speeding, and cop flashes the lights at her to pull over. And she just decides that she's going to keep driving and pulls into the parking garage at work and parks with the cop following her. And she says, I'm on my way to work. I didn't want to stop. I was worried that if we stopped and pulled over because we're downtown that we could potentially impede an incoming ambulance. And so I felt like this is the safest place given our location to pull over. So she pulls into her, he writes her the ticket, and she just walks in the building.
What?
I don't know that she got it. I don't think she got a ticket though. I think he gave her a warning.
Is garbage.
He gave her a warning. Okay.
That's called fleeing a police officer at that point. Are you kidding me? Okay.
So the second one is she gets pulled over. Of course, she flashes her badge. I don't know how she does it because she's never except for that one time, she's never on her way to work or wearing her badge. She just happens to always have it, or says that she's a nurse or something. And she gives him her driver's license, whatever, and he writes her a ticket, and she goes, I thought what about this nurse cop relationship? He goes, yeah, your license is expired. So you're lucky I'm not writing you a
cop relationship.
He goes, yeah, your license is expired. If you hadn't been a nurse, I would have written you 2 tickets.
Same team, bro. Same team.
I thought we had
What about the Alliance?
Yeah.
Oh, that's garbage. Because I drive I'll tell you like this. I drive like a grandma. Anybody that's ever driven with me knows I drive like a freaking grandma, and I have 3 tickets on my record. So the fact that you've got 0. Now, I've been told, and my initial reaction is, that is so stupid, right? The law should be applied equally, blah, 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 blah. And I just went on this whole thing about justice, right? But what I've been told is the cop doesn't want to get into a bad situation, end up on a slab, and be looking at the nurse that they gave. Yeah, that you wrote a ticket to, right? That's what I've been told. So on a personal level, I get it, okay? I do. I understand. But at the same time, that's garbage, all right? The rest of us have to deal with tickets. You should have to deal with tickets, too.
Yeah, I mean, people, throw up on me often and, that kind of stuff. So we got to give somewhere, some perk.
We got to have some
perk to the job.
You get vomited on, right?
I mean,
hey, listen,
on.
I have a child. I get vomited on all the time.
Yeah.
I will say. I get nailed at least once a day.
Cute, so
at this point. Little Owen, I know he's the cutest kid in the world. The fact is, though, he's thrown up in my eye. So I don't,
Yeah.
I'm becoming more aware of your life, Jordan.
The perk is that he'll probably, take care of you in your old age.
God,
we can hope.
I hope so. It'll be crazy. So we're gonna get it back into kind of this idea of government versus healthcare, right? And government healthcare and all that kind of stuff. And we can talk about this sorts of things. So Do you think a solution is going to come from the federal government? Or let me pose the question this way. Do you think the government has a role in public health? What is that role? And at what government level should that role kick in?
Oh gosh.
So, I mean, it's like a 3-part question.
That's
so
a hard question.
If you've got something,
I don't know that I have a great answer for any of those questions, but
Okay.
Okay, you gave me 3. What was the first one?
First one, does the government have a role in maintaining public health at all?
Yeah.
Yeah-ish.
No. I don't.
I
I
think
don't
I think I
know.
broke her.
You think you did?
I think you broke me.
I can't think of an instance where the government does take an active role in public health outside of discrimination, outside of
Funding for hospitals.
Yeah.
Do you think the government should fund hospitals?
No.
You don't think the government should fund? Oh, okay. Why?
Ooh,
Why?
I don't know.
Why don't you think the government should fund
I
hospitals?
don't know. I just want to do my job. I don't know these things. I just take care of people.
Yeah.
I don't know. Nick, you're asking me the hard questions
know.
on things I don't think about.
Questions are hard. It's all good. It's all good.
I'm sure.
So
I don't know.
There's a lot of
You
there's
stumped me.
It's all good, right? There's a lot of people that indicate that the government should not have a role in healthcare at all. These are the purely libertarian types that
Yeah.
say, listen, your body is not only your body, your choice, but your body, your responsibility, right? You should have the personal
Yes.
you should have the personal responsibility to maintain your health, also to maintain your health care. Now, here's an interesting thing, right? So people believe, there's a lot of people out there, and I know plenty of my more libertarian friends. And the thing is, I believe that there are 2 sides to this coin. There's the breakdown of the government is broken down by the individual, and then there's the government is the government, and we are all the government, right? That kind of thing. I tend to be somewhere in the middle. I think that the government is not broken down by individuals; it's broken down by families, churches, communities, that sorts of thing, right?
Yeah.
But my more super hyper libertarian people will be like, we should legalize all drugs. Also, the government should, maintain a healthcare mandate. And to me, and again, I try not to talk about my specific political opinions on this show. To me, that makes no sense, right? Because here's the thing. If I'm going to say, there's one of 2 things. Either A, I'm going to invest my taxes into helping take care of the people in my community. And I can sort of see the point there, right? Or B, everybody gets to do what they want. And I can sort of see the point there. But both of them to me do not coincide, right? So if I'm going to tell you can do whatever you want with your body, I'm also not going to pay you when I'm not going to pay you for your healthcare bill when you've OD'd for the 5th time. Does that make sense?
Yeah. Okay. So okay. I do think that your health is your responsibility.
Okay.
I do not think that what I do with my body should be paid for by other people.
Okay.
And that the government should not be trying to really play a role in that. Now, I do think the government plays an important part in making sure that drug costs are affordable because they're astronomical, and I think that's a little bit unreasonable. They need to be playing a role in patent law and that kind of thing to make drugs more affordable. They need to be giving us the option to get drugs from other countries where they are more affordable if our pharmaceutical companies aren't going to waver on those types of costs and prices and that and whatnot. Options there. I don't know that exactly. We all make our own choices. We're all our own people, and if I choose to take care of myself and this person over here does not, then should I feel like we're kind of moving around over to insurance and the Affordable Care Act and that kind of.
Go for it, man.
Is it my responsibility to pay for their health care from a mandated, like, government is taking my money and doing that thing, because there is nothing compassionate about giving my money to the government and them doing what they want with it. That's not compassion. Compassion is me saying, oh, this poor person over here is sick, let me help them, not me like, oh yeah, you do what you want with my money. Yeah, they say it's compassionate over there. They say that this is me being a nice, good person, and I am a good person because I just let the government do whatever they want and tell me I'm being, that's not compassion. And I do think we should be helping our neighbor, and we should be, because the reality is that even, we can talk about COVID-19, is that COVID-19 is extremely expensive, the care that people are getting from it, and it's not their fault. It's not the same thing as, your body, your choice. That's what that actually implies is we're not going to talk about tonight. That's it. You can have me on again and we'll talk about that.
Yeah.
But my body, my consequences, I guess we'll say, is different than people who are getting a virus or who have a genetic thing or who have that. Now, I don't know what the government's role in that is. My gut instinct is that I don't think that it's the government's responsibility, and it's not my responsibility as a taxpayer to take care of everybody in the world in that way. I think I should be taking care of other people, but not forcibly.
Yeah. So I think I
answered like 12 different questions.
That's fine. That was great.
That
Yeah,
weren't really
I think.
What you asked.
No, it's good. I like to hear that side of this. You mentioned the ACA, and the biggest problem that I have with the ACA really isn't about any specific policy. It's about the fact that the federal government mandated it.
Yeah.
It's this idea that we've let things get to such a point where we feel like we need the federal government, we need Washington, D.C. to step in about healthcare costs. The reality is that, and that's the other part of the question that I asked you was, if the government has any responsibility in healthcare, I don't know where that mark starts, whether it's at the state, whether it's the local government, or but I know it's not at the federal government. It's not. No. There's no way, there's no reason why the federal government should have any opinion at this whatsoever, unless it's something that they're going to say to a state, right? So they're going to tell states that when you are providing healthcare coverage, you can't do X, you can't do Y, right?
Yeah.
And even those, you got to be very careful with those, right? Very sparing with those sorts of things. So what is it? Where do you think the line is, right? Do you think that let's go down the ladder. We've got the federal government. That's a big no. That's a hard pass for me, and I think also for you. State government. So we're in Texas right now. Does Austin have a responsibility for the public health of Texas? And if so, what does it look like?
Oh gosh. No. But so I want to say no, because I do think that communities are very different, and what's happening in Austin is not what's happening here. What somebody doing, down there in baby California is doing has no bearing on what I'm doing here. But can we rely on if we say no, it's not at a state level, it needs to be at a local level.
Yeah.
Well, how the heck does that even happen? Because let's talk like Medicare, Medicaid, or not Medicare, Medicaid. Medicaid is a state program, right?
Yes.
So how do we break it down to a more local level? You can't, because the money that goes into, Dallas or whatever is going to be totally different than the money that goes into, Mejia or whatever.
Well,
so
the biggest responsibility, I think, of the state governments is to manage a state budget. And so if all they did was say, this money goes here, you guys do what you want. If that's all they did, I'd be totally fine with it. But I mean, do you think that, Greg Abbott or the Texas House of Representatives, do you think they have any sort of responsibility of saying, okay, all of Texas, right, from New Boston all the way to El Paso, right, from Texarkana to El Paso, and everywhere in between, all of you must do X in order to provide health care at a certain level? What would something like that look like?
Oh gosh, I don't know.
Do you think they have a responsibility to? So one of the House bills that was passed last session, or not passed, but introduced last session, eliminated pre-existing condition discrimination from health insurance.
Yeah.
Do you think that would be something worthy of a state mandate? Do you think that should be something the state should do, Or do you think that should be pushed down to the local level also?
Yeah, no, I think that would make more sense to be from a state mandate, because insurance companies are generally, they don't just serve the people of one state. They serve the people of multiple states and multiple areas, right?
Yeah.
So
Well, actually, that's not so. In health insurance, you're not allowed to buy health insurance across state lines. So.
Right, but no, I understand what you're saying.
Yeah.
But insurance companies have, like, Blue Cross Blue Shield exists across the country.
Across
now,
the country,
I cannot
yeah.
purchase it across state lines, but it's going to apply to us the way it works here in Texas. They have to comply with our. I feel like it would just be too complicated to do it at a local level, right?
Yeah.
Like,
All right.
yeah, I want to say state. I don't feel like it would function appropriately at the local level. I just don't know how that would work.
So
It doesn't seem plausible to me.
how important do you think? And again, we're in an election cycle here. We've got a lot of different people, and we're going to talk about a couple of these candidates here at a local level. But I've been looking at a lot of the local races and a lot of the races for for the state house, and everyone is, I think COVID-19 is the most important issue, right? What's the most important issue facing us right now? COVID-19. Do you think that's true? So Jordan Hormann is now running for Texas Senate. Okay, so great, congratulations.
So purely hypothetical, because that's sure never going to
Is
happen.
is COVID-19 the number one issue facing Texans today?
Facing Texans today, no. I think it's Whataburger leaving and being part of Chicago. No, I do think, okay, so I do think that COVID-19 is a very hot topic, but I don't think it is in the extent that this virus is going to hurt us and kill us and we're all going to die from it.
Yep.
I think that COVID-19 plays a role in the way that we're concerned about people having jobs, the economy of our state. I think that's a bigger issue. Now, COVID-19 directly plays a role in that. I mean, we're talking about hundreds of businesses are going out of business every day. Yeah. And that's a problem. There are people out of a job. There's been less travel, all the major airlines that are here, all the things that definitely is affected by COVID-19. But do I think that the virus itself, in me getting it, is that the biggest thing affecting Texans? Probably not. I think, though, that it does play a big role in all of the other things that are important issues. I would say our economy is probably the biggest.
Okay.
My biggest concern.
Would you say that COVID-19 is politically overplayed?
That's a tough question.
Yeah. What's tough about it? What's the conflict going on in that brain of yours?
So the conflict that's going on is I don't know what to truly believe. Right? So statistics have changed monthly on what we're counting as a COVID death. What's how many people have been affected by it, how many people are out of a job, all of these things. And it's so politicized because everybody's trying to skew the numbers to look like they're the best candidate. I mean, that's the reality of it. But my internal conflict is more personal in that the tragedy and the death that I've seen makes me want to say, no, we shouldn't downplay this. However, I recognize that my experience is definitely a little skewed because I am seeing the sickest of the sick people. I'm not seeing the patients that are, come in, don't feel that great, are there for 2 weeks and then they're fine and go home and no problem. I'm seeing the people that are there for months and they are literally on death's door and sometimes they are knocking and we are not letting them pass through. Yeah. And so that's why I have a hard time saying one way or the other because I don't know what to believe from everything you see in the news, all the statistics that are going out, because let's face it, these governmental agencies that are putting out these statistics, whether or not they'll admit it, are partisan and have a reason why they skew the numbers in a certain direction. And whether or not they all are, I don't know. I'm sure there are some that are true, but there are enough out there that are trying to flip things and sway things and skew everything that I it's hard to decide what is real and what is not.
Well, the reason why I ask that, I mean, I do, I research a lot of local and state elections for the purposes of this podcast, right? And so I go on and I say, all those yard signs that you see, all those signs that you see on the corners of the street saying, re-elect this person for city council. Yeah. I'm actually investigating those people. I'm seeing who they are, what they stand for, all that kind of stuff, which, by the way, you should too. Research your candidates. Do you research your candidates, Jordan?
I generally do. I just moved to this, what is it, district, precinct?
You're in a district. Yeah, it's a district. Yeah.
This area. So I cannot say that I have for this upcoming election. Yeah. Given that I'm new to the area. That is a flaw that I will admit to you that I have not made the time to do.
That's fair.
But yes, I agree with you that we should research.
But I do a lot of research, and what I'm constantly seeing, you go into somebody's website, the first issue number 1 or 2 is always COVID-19. What am I going to do about COVID-19? Yeah. And I look at that and I say, what can you do about COVID-19? Yeah.
What can you do? Yeah. Because we can't make the virus go away. It's not. Let's just be real. This virus is going to exist for a very long time. I have no idea how long this virus is going to stick around, but I can tell you I think it's going to be a long time. Yeah. Whether or not it's going to play this, we're going to learn more about it, and we're going to know more about what to do and how to prevent it and how to cure people who have it and all these things and the long-term repercussions. But I don't know if there's really anything anybody can do directly to influence the virus.
So Jordan Hormann now is elected as, and we'll bring this to the local level, right? So you currently live in Plano.
Yes.
Right? So Jordan Hormann is today elected mayor of Plano. Congratulations, right?
Oh, poor
Plano. Jordan Hormann does what in order to improve public health in the city of Plano? And by the way, if the answer is nothing, that's fine. You just have to make sure that you justify it.
Yeah. I think that all I can do would be to just encourage people to think about the other people around them. I mean, if we're talking about public health, I don't think that it is my that I have the authority to issue any sort of mandate. I'm not going to say, oh yeah, if you've had COVID-19, man, you're on, what's the word? House arrest for the next 6 months. Like,
are you closing businesses?
I don't know.
You're closing churches?
No.
You're not closing churches?
I'm not closing churches. I don't know that I would close businesses. I don't know that forcing businesses to close was the right thing. I think that people should social distance. I think that people should not go out if they don't need to. Yeah. But I don't necessarily know that was appropriate. Yeah. I don't think people should be out. I want to make this clear. I don't think people should have, during everything being closed, the quarantine that we were all under, I think that we should have all been at home. I don't think we should have been going to restaurants and going to bars and doing these things. I would have, if I had children, I would have kept them home from school. I would have done all of those things that the quarantine forced everybody to do. Yeah. I don't know that it was our government's right
to be able to do that.
And I don't, if I were, hypothetically elected mayor of Plano, God help Plano, but I don't think that would be within my power. I don't, if you as a person don't want to go out and about, then don't. I just don't know that I have that right. Yeah. Or that governmental ability to do that, if that makes sense.
Yeah. So the rhetoric of, the government has a responsibility to protect people. You wouldn't necessarily agree with that, right? And again, we're talking about local municipalities, right? I want to protect the people of my city, of my district, right? The government doesn't have an obligation to protect people, even from themselves, or the better, their nature, right?
does the government have the
Because again,
responsibility to protect me?
I'm just reminding you. You described
in the matter of public health.
Yeah, you described your measure of COVID-19. You described your experience with COVID-19. That doesn't sound fun. That sounds horrific. Does the government have some sort of responsibility to step in and engage? Again, I think I broke you. I think I broke. No, she says no. Okay.
I don't. I think it's my responsibility to keep myself and my family and my community healthy. Mm-hmm. And I think that if we, I think a big downfall. Now, this is not a commentary on the country or the government's initial response to COVID. I think that we were blindsided.
Yeah,
100%. I think that the World Health Organization and China did a lot to cover up how bad this was, and we didn't know. But I think that if we had all I think if I were a member of the government, I would want the people that I am serving to know the facts, to know the risks, to know that we were there to support them, whether or not that meant that we weren't forcing anything on them. I think it is your responsibility to keep your own health. I don't know that I believe that the government has a responsibility to keep us healthy.
Very nice.
I feel really like a bad nurse for
you
saying
feel like a bad
things.
nurse? Oh,
I don't know. I definitely recognize that I am in the minority of my field. My viewpoints are definitely on a minority. I still think I'm right, but
well, it wouldn't be your belief if you thought you were wrong.
Yeah,
so
it's true.
No one's ever said, this is my totally incorrect belief.
I can't buy into what I'm saying.
Yeah.
No, I do.
It is tough, right? Because, I've known you and you've always been very pro-business and we've seen a lot of businesses suffer as a result of COVID-19. And we've had to deal with a lot of things that are almost, they're so basic that they border on the metaphysical, right? Mm-hmm. What level of risk are we prepared to deal with, right? Because we've seen that, right? We've seen the level of risk, like there's a perfect way to keep us all safe. It's just no one would ever leave their homes ever.
Right.
Right. And even then, everyone's going to die. Right. But the fact is to say, well, it's too much of a risk. Well, your risks of dying in a car accident is significantly higher than your risk of dying of COVID, with or without comorbidities, whether you're 70 year old or not. Right. But we drive because we've assumed as a society that the risk of death for driving is worth, we've made that calculation as a society. But then they injected this whole new thing, and it's novel, it's new, and I think that's the issue, right?
Yes.
We're saying, oh, this is a new thing, and it involves a new risk that we didn't have to consider before, so we're having to reassess that in our brains.
Yeah, I think that's a great
as a collective society.
Example. I mean, and it's hard to say these things, especially given what I've seen, and the stories that I've heard about people not being able to plan their loved one's funeral or feeling angry because they are planning their loved one's funeral, and the funeral receptionist lady isn't wearing her mask as they're telling them that their loved one died of COVID.
Yeah.
I've heard those stories, and it's heartbreaking and tragic, and I have experienced grief that I've never seen before. But at the same time, as awful as those things are, I think you're right. It is a risk that we have to weigh. And I think that there are things that we can do to lower that risk, but they're all personal things, and you have to decide what your own risk is and what you're willing to put what level of risk you're willing to put yourself in and your family. And those are all personal choices that you have to make for yourself. And if you choose not to, I can think you're wrong. I can think that your risk is, I wouldn't take that risk. And I can think that you're dumb for taking that risk. But I don't have the right to say you can or can't.
Yeah. So I think it's interesting. Earlier you said that, and not too much earlier, but you said, I'm not sure, right? Jordan as the new mayor of Plano, right? I'm not sure that I would close businesses, but I am sure that I wouldn't close churches. And that was an interesting distinction, right? So what is it? Because you were quick. You were real quick. I said churches. You said no. Why not? Why not churches? Because churches seem like a kind of a hyper, I don't know what the term is that people are using now, the super spreader, right?
Yeah.
If there were ever a super spreader, right, a place where everyone's all kind of collected together and usually singing, right, and spitting on each other, that seems like if there ever was a super spreader, it might be a church. So why so quick to say no on the churches?
Because I think that going to church is a fundamental right that we all have, and I don't think that it is the government has the right to say, no, I cannot go to my place of worship and worship how I choose. Yeah. And I think that, yes, a church is supposedly on this list of super spreaders, and, there's been stories of choirs, and everybody in the choir gets COVID because of they're all singing close proximity to each other, but you can wear a mask. I think our church, you and I go to church together, and I think our church has done a really good job of, we stayed closed for a long time, and while I would have liked to have gone to church in person, I don't think that the government has the right to say that no, I can't. Yeah. Now, I may have chosen to stay at home longer and to have worshipped from my living room, but the government does not have the right to say that. And I think our church has done a good job of, trying to encourage people not to, be in groups too big, to spread out, wear a mask. I wear a mask when I sing. It may be a little uncomfortable and maybe kind of weird because it's just like flapping in and out while I'm breathing. But that's how I'm choosing. I am choosing to put myself at risk because worshiping with my community is important to me, and nobody has the right to say that I cannot.
Very good. Are you sure you're not running for mayor? That sounds like you got a passionate platform there.
Oh, I just, I got a lot of feelings.
Got a lot of feelings. All right, cool. So this is gonna be the last question before we go to our next break. But I do wanna poke at you. All right. So this is another hypothetical situation. Okay. Now you're not mayor, right? You're back to being a nurse.
Good.
Okay. We're back to being a nurse. But Governor Greg Abbott comes out and says nurses, right? So in hospital, we're going to do a full, effective revamping of the healthcare industry in Texas, right? We're going to put in new equipment in all the hospitals, new state-of-the-art equipment. Everybody's getting one. We're expanding everyone's unit so that they can host more beds. Nurses' salaries are going to go up by 20%, right? Right. So you're getting a massive influx, and whatever you need, we got you.
Okay.
In order to pay for it, Texas is instituting a 4.5% state income tax. Are you for it or against it?
I'm against it.
You're against it? You're getting a salary increase.
I would love it, but, I'm really not, though, because you're just going to take 4% of it away from me. I mean...
Okay.
Am I also exempt from this income
tax? Okay, sure. You would be, right? Healthcare workers would be exempt. No?
No.
Oh my gosh! But we gotta pay for.
You just want to hear me say it.
I do.
Income tax is theft.
Income
tax is theft. It is not. Oh no.
Man,
Governor Greg Abbott would never do that.
He would never do that. I don't imagine he would do that. There are some people in the Texas State Representatives Texas House of Representatives rather, who are lobbying pretty hard to reintroduce a state income tax for sure. And I've got my own feelings about state income tax. I try again to leave opinions and feelings to my guests, but yeah. So income tax is always an important thing, and we'll discuss that probably on another episode. But one of the great things about now we do have a rather high sales tax. What do you think? What do you think about that? Do you think that state?
Oh, I have no problem with sales tax or luxury tax. You can tax me to purchase things, to buy items, to buy goods or services, but you should not be able to tax me for working and producing.
Yeah.
That's where my big issue is. I don't mind paying other types of taxes. I'll pay a special toll to drive on the DNT because it's faster. I pay money to do other things because they are convenient to me, and because I want them or whatever. I don't think that taxing me for working is appropriate.
So the case here is that running a state is expensive.
Sure.
Paying for the health care of multiple millions of people in the state of Texas is expensive. We're going to have to pay for that some way, right? We can't necessarily. I mean, Texas has done a pretty good job of keeping a fairly balanced budget and not running up a giant deficit.
Yeah.
But it does have to be paid for. How are we going to pay for that? I mean, would you be in favor of increasing the state income tax to something like 10.5? Because right now we're at 8.25. So
Sales tax?
Sales tax, yeah. 10% sales tax?
I mean,
That'd put us at like California levels.
yeah. I mean, my gut response is no, because I already pay enough on groceries. Like, I don't want to use...
Gosh, man, you can blow past $200 at the grocery store and not even know you did it.
Like, all I walked out with is like some cheese and bread. Like, what the heck?
Yeah.
No, I do think we need to take a look though at what we're spending our money on. I mean, I don't know that necessarily you should just keep adding and adding and adding the list of things that the government is paying for. I understand that running a government is hard and expensive, and that the money has to come from somewhere, but maybe we need to look at how it's being allocated. Do we really truly need more money, or do we just need to be spending less?
Yeah.
I mean, that's where my big concern is. Additionally, I think you can look at, who's getting tax breaks that shouldn't be getting tax breaks. Where are we, I think the allocation of funds is probably a bigger thing, because you've got a lot of people who live here and a lot of people are buying things and doing things and living, and where's the money going then?
Yeah. So do you think that the government is justified in this pandemic to spend more on healthcare, or maybe prioritize and increase the allocation of state funds into healthcare? Or do you feel like the government should back away from healthcare? And again, as always, we're talking about state and local government.
Yeah. Do you mean like...
So we're not going to increase the state income tax or anything like that. Take the taxation out of it, because
right.
I got you to say taxation is theft, which is
that's
the
all
whole
really wanted.
point of this question, right?
That was your goal, the whole inviting me here.
Yeah, but but I will say, so I'll say this, right? Everything stays the same. We're just reallocating how we spend. Should we prioritize healthcare in that reallocation of funds, or should it go elsewhere? Again, just to give you some examples, because so infrastructure,
sure,
or Social Security, or or some level of Social Security, or I don't know. Social Security. Well, but you know what I mean, like
thanks, FDR, for that
like
nightmare.
protection buffers for the poor, things of that nature. Local business investment, that sort of thing.
I don't know. That's a good question. I still think it goes back to whether or not, like, whose responsibility is it to pay for my health care. I think it's mine. I don't think it's the government's responsibility or your responsibility to pay for my health care.
Yeah.
I do think that the government state and local governments have, I think there was talk about, increasing funding for PPE and those types of things, for healthcare providers. I do think some of that is helpful. I do think that, or appropriate. I think that the local government at least funding, or reallocating money to like testing, those types of things are important. But I also think that we need to be encouraging, maybe to ultimately help, to impact COVID-19, maybe our local government needs to be moving funds towards helping local businesses, because if people aren't feeling the need that they need to get out there right now because their local business is protected, because their finances are protected, because their home is protected, they don't have to worry about getting evicted, those types of things are maybe a better way to moving funds towards schools, so we don't have to send our kids to school. I'm not even worried kids aren't getting it, but what about all the teachers? What about all the staff? What about all of that? If maybe moving it directly to healthcare isn't the answer. Maybe moving it to all the things that are going to impact how people behave and how people congregate will make a difference. Does that make sense?
Yeah. So if you're saying that if you protect the things that we would normally have to go out and pursue in life, right? If the government were to ensure that people would behave more responsibly in staying home and
right, and that maybe we would decrease the spread a little bit, and that maybe that would not require government involvement on healthcare.
I think about,
because I don't really know what's the government going to do to help healthcare. They're just going to pay for all these ECMO patients that are uninsured, and is that what you're asking? Like,
well, I mean that's what the
hospital just eats that.
Yeah,
Baylor's $33 million in debt. I mean,
I will tell you that's what a lot of state mandates have pursued. It's just we're going to allocate funds, and that really is. I mean, other than making some sort of mandate as to influence people's behavior, which I'm getting mixed vibes, but I think you're not in favor of that. right? But other than that, really, it's just a matter of spending money on making sure that hospitals are well equipped and well staffed.
Right. Well, yeah. I mean, that's a good point, though. I don't know. I don't know that I have a great answer or a great viewpoint, because I do have these, ideas of personal freedom and taxation, and my healthcare is my responsibility and nobody else's. But I also do work in it, and I've seen the fact that we are short staffed, that my hospital is incredibly in debt, and that this is not helping any of that. And we did not have PPE for a long time. I mean, I think I used the same reusable disposable mask for like a month.
At your job?
At my job, yeah.
I'm going to scoot a little further away from you on the couch here.
It's been a while. We've got good ones now. We can just throw them away.
Yeah.
So I don't know. I have a lot of conflicting views on that as a private citizen, and also as, a healthcare professional. And I struggle with those things often, but I think my overwhelming view is that my healthcare is my responsibility. Your healthcare is your responsibility, and I don't want the government infringing on my rights as a private citizen, and those things conflict.
Jordan, this concept of having the government insure the things that we need to risk COVID in order to maintain, like our businesses and our schools and our livelihoods. The concept of having the government allocate funds to ensuring those things so that people do not so people are less incentivized to go out and participate in them. I've been thinking about local and national government for my entire life on an almost daily basis, and that has never occurred to me. That is a phenomenal answer to that question.
And you running for mayor?
Yeah, so now we're running for mayor of Plano. I'm putting you back on the ballot. That's a really good answer. Now, man, now you got me.
Up with it here.
I'm just off the top of your head, right? You don't have any notes or anything. I'm looking at you right now. Oh man, I got to chew on that for a little bit. So we're going to take another break here, and when we come back, I'm going to talk about some. You want to talk about some elections? Some local stuff?
Sure, since we know I'm so well prepared,
well versed and well prepared, right? Well,
about my election.
we'll get your opinion on some of these things when we come back. As promised, here on Local Matters, we always try and talk about things that are actually touching the local communities. And right now we're in election season, so that's giving us a lot of great fodder, right? A lot of great content for that. We will touch on that here in a little bit, but I'll see you on the other side, friends. Howdy, friends. Welcome back to Local Matters. We are here with the singular Miss Jordan Hormann. I've talked quite a bit about COVID-19, how that affects you at the local level. What are some things that you can do to avoid it? Whether or not it's worth being avoided. Jordan has just spilled a lot of good stuff on us today, so I really love having her on. We might have you on another time. Would that be interesting? To talk to you about some other stuff?
Sure, I've got lots of opinions.
I am aware. I'm aware, right? And again, it's interesting. We say, Nick, this is a local podcast. Why are you talking about COVID-19? Because the fact is that COVID-19 is everywhere, right? It's affecting us on the national level, and we, it's affecting us as a nation. But that's not the same thing as saying it's affecting us at the national level. I think it's important to note what the federal government can do, and whether or not it is really best for the federal government to be making policy on this. Whether or not they should just kick it over to the states, or whether the states should kick it to the municipalities. Those are relevant questions, and they have to do with how you exist on your how you exist in your city, right? In your city, in your state, right? You have to understand that's how this is designed to work. And really, that's what's most effective. Federalism is a beautiful thing, friends. I try and stay away from really dramatic political opinions on this podcast, but one thing I will never be ashamed of is my love of the federal system, right? The fact that if we don't like the way things are run in our area, we can move to another one, right? And that is not just talking about, we talked about Jordan's way back at the beginning, Jordan's parents moving from Washington State to Texas, but that also works if you don't like the district that you're in, right? Mm-hmm. If you don't like the way Plano is run, then go to Carrollton. If you don't like the way Carrollton is run, go to Arlington, and so on and so on and so on. And we live in a great state for that, and I just really like to kind of hone in on what these national issues like COVID mean for us in our day-to-day lives, and how they should be implemented. So I'm really thankful to have Jordan on the podcast for that. But we're now turning into stuff to which she has admittedly said she does not know very much about, which is local elections. Now, Jordan, what have you done to research your candidates for this election that's happening on the 3rd of November? The ones that are not named Trump or Biden.
Yeah, nothing.
Nothing at all?
I've seen some yard signs. Not on my yard.
Shame.
Yeah,
Shame,
I know.
Jordan.
I know. And as somebody who is very adamant that my right to vote is as important as it is, I'm a little ashamed, but I've been busy.
So
I've been real busy.
Yeah, I can believe that. I can certainly believe that. So let me ask you this before we get into these specific candidates, who ironically, and we'll talk about why, these candidates will not be on the ballot that you receive when you go to the polling place, and I'll tell you why. It's just it's an interesting thing, but they are nonetheless very important. When you go to the ballot, right? When you go to the polling polling location, you receive a ballot. The very top of that ballot is Trump, Biden, and then Hawkins and Jorgensen, right? You know who you're voting for. That ain't changing, right? That's pretty well locked in because obviously we know just about, except for some of the minor candidates, you might have to do a little research, but you know just about everything that you need to know about the candidate to make that happen. But you start going down the ticket. Maybe you get to your state and you say, oh, John Cornyn in here. He's my representative for the United States Senate, right? Him and Ted Cruz are the Texas senators. Okay, we're still at the national level. I kind of know who that guy is. I know whether I'm going to vote for him or not.
Yeah.
You might have seen some commercials on YouTube. Hell, you might even seen the commercial on this very podcast. You might have seen one of those MJ Hagar / John Cornyn commercials. But then you start getting into your state representation, right? Maybe the governor's up for, they're going to be on the ballot this year, which isn't the case, but let's say that they were. But you start getting down into local stuff and you don't know who these candidates are, right? Now, they have a D next to their name or an R next to their name in some cases, sometimes not, right? Sometimes there's just one, they're independent or something like that. What do you do? What do you think a responsible voter should do if you've never researched the candidate, you don't know anything about them except for whether they're Republican or Democrat? What do you do? Do you go with your normal party? Do you leave that part of the ticket blank? What does a responsible voter do in your opinion?
Well, whether or not it's responsible, I can tell you what I have done in the past.
Yep.
So I have only ever participated in voting. I've only voted during an election, a federal election year.
Okay.
So, multiples of 4.
Yeah.
So the last election, when was that? 2016. I only voted for the candidates that I had researched, which meant that I only voted for senators and the president. I did not vote in my local elections because I was very uninformed on what was going on and what the issues were. And to me, I felt like it was not responsible to vote for a candidate that I knew absolutely nothing about, knew nothing about their voting record or their platform, because state and local politics are drastically different than
what's going on at the federal level.
On at the federal level. Exactly. So I did not feel comfortable voting one way or the other. I do know that a lot of people tend to vote, just by what that letter is. And I think that there are pros and cons to all of that, but it is only, I think, if you have researched what your party's platform explicitly says. Because a lot of people are like, I hate those Democrats. I hate those Republicans. I'm not going to vote for either, I'm not going to vote for that party ever. But do you really know what the platform says? And if you do really know what the platform says and that's what you're voting on, then fine.
I will also
But
note,
I think you need to be informed on that.
Yeah, I will also note though that party platforms at the broad level are pretty well set. But individual candidates will emphasize or de-emphasize various parts of the party platform depending on the state and municipality that they're running.
Yes, exactly. And party platforms tend to be more, the platform tends to be more slanted towards how it's going to affect the federal government, not your area, your city, your municipality, whatever.
Which is a tragedy, in my opinion. The other thing that's important, what's your policy on the full ticket voting? So you'll notice a lot of ballots, and this isn't the case in every state, but I know that it is in certain areas here in Texas for sure. You'll get a ballot, and you have the option to simply just select R&D at the top of the ballot. What's your policy? What do you think? Do you think that's useful? Do you think that's effective?
I mean, I think it's only useful in the fact that you may be using less ink.
We have an environmentalist here.
Save you a little time.
Yeah.
I mean, my time is money, but
Okay.
I don't. Now, I have admitted that I have not researched these candidates for for the upcoming election, and I will do my best to try and be informed on election day. And although I'm voting early, so October 29th when I have it scheduled in my calendar. And if I am not comfortable, while I have researched the platforms this year, I do not think that it is responsible to just be like, nope, I'm voting for this. I do think that while I have not done this, I think that the responsible thing to do is to research each candidate individually and what their voting record is, what they stand for, what the things they, like you said, are emphasizing within the platform and whatnot. I think that is the most responsible thing to do. I will 100% admit that on this election, I have not been what I would like to have done.
Well, we can all aspire.
Yeah.
Right?
So, the next election, that is what I will do.
Very good. Well, I mean,
try in the next 14 days. Or
yeah,
long
a lot
it
of my
is.
listeners. So what you can do, and I'm just going to recommend this. Now, this is not a sponsor. Hopefully, maybe someday. But there are programs out there like Ballotopedia where you can go and put in your address, and it will give you a sample ballot
That's
for
fantastic.
who's going to be on the ballot, and then you can go and research those candidates yourself. I highly recommend that everybody do that. Pay attention to the bottom of the ticket because, again, you know how you're voting at the top of the ticket. If you want to know my feelings on full party ticket voting, you can listen to the last podcast that I did where I gave a 15-minute screaming session about it. So you guys can go do that yourself. I'm not going to reopen that wound, but let's take a little bit of time and talk about some of the more local elections. Now, last podcast we talked about the Texas House of Representatives, right? We talked about House District 65, the race between Michelle Beckley and Kronda Timish, and the various candidates and what they look for. Now, we're going to go a little bit lower down the ticket today. We're going to talk about cities. We're going to talk about different cities, and this is an interesting thing. So there's a very good chance that your city's mayoral race or city council races will not be on the ballot when you go to the polls for the federal election, okay? And the reason why is because most of the time, in most cases here in North Texas, the city elections are not held at the same time as the federal election, right? For example, Carrollton, what we're going to talk about today, as well as Arlington, and I think just about every city here in North Texas holds their city council and mayoral elections in May. Whereas they hold the national elections in springtime, in November, obviously. But that has changed. Governor Abbott actually made a statewide mandate, and this might be a state policy. Now that I'm thinking about it, I'll have to investigate whether or not this is a state policy or this is a county by county thing. But there was a state mandate that said all local and mayoral city council elections are going to be pushed from May to November, which is why you're now seeing a lot of signs for city council and mayor races out there in your state in a time where you normally wouldn't, because the two elections are being held at the same time. Now, the reason why I like that is because if you didn't know that, right, there's a good chance you've never voted in a city council or mayor election if you didn't know that. What that means is that I love that personally, because that to me means the only people who are voting are the people who care.
Yeah.
And that's
fair.
a big deal, right? Because if you say to me, I don't care about politics, that's fine, don't vote. Right? I mean, if you don't care, then don't vote.
I think everybody should care.
I think everyone should care and everyone
care.
should vote. Okay.
But if you don't care,
Yeah,
I think that's fair.
Yeah, so that's why I like city council and mayoral elections, is because they are appealing to the people who actually care about the issues and have a stake in it, right? It's a bit controversial to say. First of all, I am a favor of everybody's right to vote. Everyone should have the right to vote. Everyone should have the ability to vote. But just on a personal level, if you're not willing to do even a little bit of research, then I don't know what you're doing in a ballot box, right? But again, in my ideal world, everybody would care and everybody would vote. But yeah, so a lot of times you're not seeing as high a voter turnout at some of these elections, and as a consequence, there really isn't that much investment in party. right? So when you're getting to city council and mayoral elections, if you do research on these candidates, the one thing that you won't see in most cases is an association with a particular party. Now, you can look at their platform and it becomes fairly easy to line them up, but there really isn't. You're not seeing a lot of vote, blah, 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 Democrat for city council or mayor, right? So you're getting a little bit more of into the nitty gritty of who this person is, rather than having that sort of fallback of just go with the D or just go with the R, okay, or just go with the I in some cases. So I like that. I like that a lot about local elections, and I think that people should invest in their local elections because it gives them experience on how to do research on their candidates and what it is that they value and whether that lines up with them. So we're going to talk about one election in particular. I want to talk about this one because this is just, this is just a sexy local election. I really love this. And if you live in this area, you've probably heard this story. But if you haven't, it's going to be a bombshell. Well, it's not going to be a bombshell, but it's going to be a little juicy bit of something. And so we're going to talk about that. And if we have time, we'll break into another city council election. But we're going to focus on the city of Carrollton, which is so I live in Dallas, but when I say a stone's throw from Carrollton, I couldn't throw a stone, but if it was Clayton Kershaw could probably throw a stone and hit Carrollton from my house. And that's not an exaggeration. I live very close to Carrollton. I do have an investment in, I know a lot of people who work in Carrollton. So this is a big deal for me. And I know it's a big deal for Jordan as well, because again, we have a community where a lot of people work in Carrollton and in that area. So it's a big part of our local investment. One of the things about being part of a big city is that all of these sorts of things blend together. You might not live in that district, but there's a good chance you work there, or there's a good chance that you're going to commute there, or you patron the businesses there. So we don't necessarily need to focus on just our county like you would if you lived out in Lubbock or somewhere in that area, right? But this is a good, an interesting part of things. Carrollton is a fairly small suburb of Dallas, but it's growing quite a bit, and it's developing pretty quickly. So we're going to go through these two elections, and Jordan, I'm going to ask you to chime in on your thoughts and your opinions based on what I say, knowing that you haven't necessarily done a full investigation. Let's talk about the mayor's race, okay? Again, normally the mayor's race would be held in May, but due to COVID, we're holding them now. So we're going to talk first about the incumbent, right? Now, one of the things I like about Carrollton is that all of the Carrollton all the Carrollton voters get to choose people with really cool names. The current mayor of Carrollton, okay, so the incumbent running mayor of Carrollton is a man named Kevin Falconer, which is a great name, right? You've seen his signs because they've got a big falcon on them, because of course, right? If you got a name like Falconer, that's what you're going to go with, right? Once again, I have been researching Kevin. I do not see any strong affiliation towards one party or the other. Now, when I read you his platform, you'll probably be able to put him in one of those categories. But it is worth noting that he doesn't strongly identify as a Republican or Democrat or independent. And I think that's a good thing. So one of the big things about when you're researching your local candidates is figure out what their priority issues are. Good way to do that is to go onto their website, click on the little tab that says issues. If they don't have one, don't vote for them because they don't know how to run a political candidate, right? They don't know how to run a political race, right? Or a campaign. That's what I'm looking for, right? But they should, and they likely do. And if they do, click on that and see the first 2 to 3 things that come up, right? Because everybody's going to have some hot button issues on their full list, and it is helpful to go through and read all of them. But if you don't have a lot of time, just look at what are the first 3 things. That shows you where this person's head is at, where their priorities are. So if you look at Kevin Falconer's priority issues, there are 3 of them. One of them is public safety. The other is small business investment, and the third is community development. Now, Kevin Falconer is, when he's not being mayor of Carrollton, he is an architect, right? He works for an architectural firm. Specifically, he works for Yum Brands. So Yum Brands, for those of you that don't know, is Pizza Hut, KFC, and Taco Bell. Right, those are owned by Yum Brands. So a lot of times you'll see there are a lot of stores out there that have a Pizza Hut and a Taco Bell in the same place, or a KFC and a Taco Bell in the same place. That's because they're all owned by the same company, right? So yeah, exactly. They're all owned, but it's all the same, right?
Copy paste.
It's
copy,
all
paste.
the same. But so specifically, Kevin Falconer works for the Pizza Hut section of this, and designs a lot of the Pizza Huts that you've been seeing popping up, right? So he works on designing those buildings. He works for them. And you can definitely see if you look at his platform that he has an architectural mindset, right? Now, Jordan, your husband works for an architectural firm.
I mean, can you really say that he designs the Pizza Hut?
I don't know if he designed
or
well,
he just cuts and pastes the Pizza Hut from this street to that street.
So here's what I want you to do. I want you to go look up Kevin Falconer. I want you to read. I want your husband to read about it, and I want to hear his opinions on this dude.
Yeah, well,
Because
we'll send him a text right now.
he very much has an architectural mindset. And you can see kind of from the things that he's done, right? He's very focused on developing the area, right? Developing Carrollton. You can't really expand because Carrollton is nestled right there in the middle of all these other districts and suburbs, right? And so you can't really expand and build more. So he's focusing on how do we improve or expand on the buildings that we already have.
Yeah.
He the funny thing is I don't see that many Pizza Huts in Carrollton. I feel like because he is our mayor, or he is the mayor of Carrollton, I should see more Pizza Huts there.
Maybe it's just like a conflict of interest. And
It
so
might
they're
be.
like, we just got to have more Papa John's around.
It might be. I mean, I see plenty
Better
of
ingredients, better pizza.
See, that is not a part of Kevin Falconer's platform, right? I see a lot of Taco Bells, and I see a lot of KFCs, KFC. So their Yum Brands definitely has a presence in the area. But yeah, it just pointed out as I just thought about that. I said Kevin Falconer designs Pizza Huts, and it just occurred to me, every Pizza Hut looks exactly the same, right? They're all that weird red roof, right? The hut roof. But I don't know. Maybe he designed that. I don't know. So let's talk about some of these other ones, right? He's, we'll say in here in a second, for his career, he is overseeing one of the bigger developments, in fact, the biggest development in Carrollton right now, which is the Trinity Mills, I think it's called the Urban Village, right? Trinity Mills Urban Village, which is happening at the DART station in Carrollton, right? Now, do you know anything about that, Jordan? Has Eric said anything about that?
No. No, I don't know anything about it. Eric does K through 12 schools, so I can tell you about all the cool schools that are going up in the area.
There you go.
But I don't really know much about that.
Well, he's doing a school in Oklahoma though, right?
He did design a school up in Broken Arrow, but he's working on a school right now in I don't know if I'm allowed to talk about it. I think I'm allowed to talk about it. In Richardson, they do lots of schools in Plano, Mesquite, all.
We'll have to get on. No, that's not true. I don't want him on here.
I'm the interesting one.
He's I don't know. I could probably poke at him for a little bit. But yeah, so you're seeing a lot of community development, emphasis on that, improvements, trying to get a more aesthetic appeal to Carrollton. Because a lot of people that are commuting from one place to another, going through Carrollton, they are wanting to become the next. It seems like they're wanting to become the next Frisco, right? This previously small suburb of Dallas who gets a lot of business action in there, and then all of a sudden they're building, these really important things that people are coming to see, like the Star, right? Or something like that. Now, whether or not Carrollton's going to have that, I don't know. But that does seem to be Mr. Falconer's ambition here, right? I've looked at some of the designs for which I looked at architectural designs, and I had no idea what they meant, but they had a lot of really fun pictures. And from what I can see is that this is meant to be sort of a shopping districts, right? For those of you guys who live in the area, think Shops at Legacy or Texas Live over in Arlington. One of these sorts of cultural shopping hub districts, and they want to plan it, of course, right there at the train station because you get a lot of foot traffic in that area. That's a big thing. And his really big thing is public safety. He's endorsed by a lot of members of law enforcement, and he really wants to invest in law enforcement in Carrollton in order to keep people safe, both from, and he even mentions on his platform, both from COVID and from crime. And you've seen a 40% decrease in Carrollton's crime over at least this is his claim, 40% decrease in Carrollton's crime during his mayoral tenure. And so those are his big emphasis. Now he does have other things. He talks, he talks a lot about police injustice, right? He talks, about sort of dealing with that as it pertains to law enforcement. He also has some opinions on healthcare and COVID. But those are the three main focuses: investing in small business, community development, from an aesthetic perspective, from an architecture perspective, and public safety. That's the big one. Do we have any thoughts on that, Jordan? Does this sound like someone you're voting for? Are you voting for the architecture guy?
Well, I don't live in Carrollton, so
Yeah, so you won't be voting.
It's gonna be a no.
Yeah.
But I mean, from what I've seen of Carrollton and what I know about what's there and what could be there, I mean, I just did a quick little Google search and looked at this. I mean, I think that sounds like something that I don't know what the people of Carrollton want, but as somebody who visits Carrollton, I think that would be beneficial to the city and to its growth and its economy and the people who live there and property values and those types of things. I would assume would be a good thing.
Yeah.
It does look quite nice. I just looked it up. It looks really cool. It does remind me a lot of the Shops at Legacy, which I frequent because we live like right near it.
You live in the Shops at Legacy.
Right next to them, within walking distance, which is great. And I think the people of Carrollton would love that.
That's great.
Definitely would help, the businesses that are there would frequent, new shops and restaurants and whatnot, and maybe help. I don't know. I think it sounds great, but also, I'm on board with supporting our local police and less crime, and so
it's all good.
it all sounds nice to me. Who's the other guy?
I don't know. We'll talk about the other guy in a second. The other guy is awesome. I love the other guy.
Because that's what it is. One guy sounds good, but does the other guy sound better?
So, okay. Here's the thing. Well, before we get to the other guy, and we'll get to the other guy, trust me, right? Because I do want to kind of get your opinion on as a voter, right? So you're going to vote in the Plano elections, right? Mm-hmm. Hopefully, right? You do your research. You'll vote in the Plano elections.
You gave me a good website. I'll go check it out.
What are the things you say? Okay, I'm voting for this guy because he emphasizes X, Y, and Z. So we talked about the priority issues. Let's say we'll just do two, just to keep it simple.
Okay.
This guy's got these two, number 1 and 2, for your ideal candidate. Priority issues are go.
Oh.
I figured this would be an easier question.
No,
than I
it
thought
wouldn't be
okay.
because the reason why it's not an easy question is because I have just moved to the area, so I don't know what the problems with my area are.
Oh,
right off the bat, because I know where I lived, where the problems were. I've got a lot of things to say about Uptown Dallas, but or Oaklawn, wherever I lived.
You live in Oaklawn.
I live in Oaklawn. Before moving up to Plano, we love the burbs. We're very happy there.
I think pretentious people. There's a mandate against pretentious people. That would be my vote. No.
Yeah, that sounds good. So I don't really necessarily know what the problems with Plano are. We live there. We have not. I would not call us Planoers. Planoites.
Planoists.
Until I have a problem with words that involve people from.
We've got to figure out what that is, right? What you call people.
But yeah, I mean, I guess my concerns as a citizen of Plano would be, as a citizen of anywhere, what are my concerns? Safety, I think, is a big thing. And my money. I care about my money.
Where your money go?
Where's my money going? Mm-hmm. What is my money worth? Yeah. Those types of things.
My wife always says, "Uncle Sam is the worst uncle. I send him all my money, and I don't even get a Christmas card."
Nothing.
Yeah.
Nothing.
Anyway, we've already been on that train. Okay, let's talk about the other guy. So again, who's the other guy? Well, here's the thing. Kevin Falconer is currently running unopposed.
What?
Wow, Nick.
Why?
Wow. You said this was a sexy election. An unopposed election is not a sexy election, right? Well, the reason why he's unopposed, he was very much opposed for the first little bit. He was opposed by a gentleman named Zul Mohammed, which all I can think of, when I think about Zul, all I can think about is Ghostbusters, right? Of Zul, right? You didn't watch Ghostbusters?
I've never seen Ghostbusters.
Zul is one of the bad guys in Ghostbusters. His name is Zul Mohammed, or it might be pronounced Zul. I'm not entirely sure. Zul Mohammed, who was running previously for the mayor of Carrollton. He is no longer because he is in jail. Because he is in jail for voter fraud for 109 counts.
I thought that wasn't a problem, though.
I know. For 109 counts of voter fraud, right? So he basically mailed out a bunch of blank ballots, right, to people who did not request them. So we have to talk for a second about the difference between absentee voting and what we're calling mail-in voting, right? Absentee voting is you request a ballot is sent to you, you send it in. Now, usually this is for people who are overseas in the military or have some reason why they cannot go to the polls, right? You request a ballot on time, it's sent to you, you send it in, we're all good. It's all copacetic. Mail-in voting is what this guy was doing, is he was sending out blank ballots to people. He's printing out and sending out blank ballots to people. He was then harvesting them by having them sent to a P.O. box. And he was caught, right? So that P.O. box was then taken, and it was caught with 100 ballots that had been taken like to his house, that he was then sort of like throwing out the ones that he didn't want in order to process them and take them to the polls.
How did he get caught doing that?
Because they had somebody. So at the P.O. box, which is a P.O. box in Carrollton, right? I guess it was somebody called it in, and they had a detective, right? They had an investigator or something like that go in and basically case the joint. I think he was there like working and posing as an employee. I'm not entirely sure of the story, but it was crazy.
It's like the most boring undercover job.
Yeah,
ever.
you're working at
a
UPS essentially, right?
Oh
at the PO box. And somebody came in and took it, and then they followed the guy to his house. The police were able to get a warrant. They searched the house, and they found a giant box of ballots. And I don't know if you guys know this, but when you're caught for voter fraud, every false ballot is a separate case. So this dude is currently being charged. He was arrested and charged with 109 counts of voter fraud. So this is bringing up an interesting conversation, right? Because we hear a lot about the mail-in ballots, right? The mail-in ballots at a national level. Now, I'm gonna have kind of a weird opinion. I really don't care about mail-in ballots at the national level, because I feel like unless there was a national mandate where everyone in the country was going to get a ballot, that'd be one thing. But at this point, it's kind of being done on a state-by-state basis. And I feel like most states, with the exception of certain swing states, are going to vote the way they're going to vote. Mail-in ballots isn't really going to affect it that much, right? But I really have an issue, for reasons like this, really have an issue with mail-in ballots at the local level, right? Because 1,000 false mail-in ballots in a national election is
Makes
nothing.
no difference.
It's a drop in the bucket.
Yeah.
1,000 mail-in ballots in a local mayoral election?
Because who's voting in these elections? The people who truly care.
Exactly.
And there's not very many of them.
And that's a big deal.
Yeah.
It's a much bigger deal here, right? So, again, this is one of the problems with always thinking within the federal scope. Because in the federal scope, is mail-in ballots going to be? I mean, we'll see. Who knows? Maybe there are a billion ballots that are harvested or something. Maybe one way or the other, we have another 2004 hanging Chad situation. Who knows what happens with mail-in ballots? But to be honest, I don't care at the federal level. I care very much at your local levels, because you're getting into the place where 100 ballots makes a big difference, right?
Sure.
10 ballots can decide an election. And so at your local level, you really should care about what the policies are for mail-in voting in your area, and also what measures are being taken to prevent voter fraud, right? So that's a big deal, and I think you really should. I mean, as someone who's voting in Plano or Carrollton or whoever, I really think you should make sure that you know what's happening as far as mail-in ballots, right? What's the justification for it? Because again, if you live in Loving County, Texas, COVID is not a big enough deal in Loving County. And I'm just going to go ahead and say it. COVID is not a big enough deal in Loving County, Texas, to where people shouldn't go to the polls, right? Because Loving County, Texas is the least densely populated county in the entire United States, okay? So I feel like in your local election, you should know what the policy is on mail-in voting, what the justification for that is, and what is being done to prevent voter fraud. I can't stress this enough. This is a big deal when you get into the stuff that actually affects your life. And your local government affects your life in a more direct way. And you have higher cases of voter fraud in state and local elections. Right? So Jordan, what is your, and again, I'm trying to keep my opinion out of things, and I just can't do it. What are your thoughts on the mail-in? And as somebody for whom COVID is a daily reality, do you think people should go to the polls?
I do think people should go to the polls.
Okay.
So I'm voting early. I'm a nurse, right? It's gonna be hard for me to get off. Technically, it's my right to get off. Blah blah blah. They can give me 2 hours. Yada yada.
Yeah.
It's just not plausible.
Okay.
I'm needed at my job. But that being said, I have looked it up. There's like 25 different places I could potentially vote within Collin County for like 25 different dates. Okay, there are opportunities to go out and not be packed. You know, I think if I'm going to go, I'm going to wear a mask. I'm going to use hand sanitizer before I don't know, is it on a computer? It's been 4 years since I voted.
I voted in 2018 and I had to fill
paper.
I had to fill out a paper ballot. Yeah.
I think I had a paper ballot. This was in Oklahoma 4 years ago. Pretty sure it was paper ballot. You know, I'm going to use hand sanitizer before I touch the pencil. I'm going to, or pen, whatever. I'm going to use it afterwards. There you go. I'm fine. Okay. You know, I don't think that. I think there are ways to vote and be safe about it.
Okay.
You know, I think that it's important. I think it's your civic duty to do it. I think that we've done enough to flatten the curve. I think there are plenty of dates and plenty of locations that you can go out and you can vote. I think within the DFW area, yeah, there's probably going to be more people there than there are in, you know, more rural areas, less densely populated areas. But I think it's fine. I am not concerned about voting on election day.
Okay. All right. So here you heard it here, folks. You heard it from a medical professional. Go vote.
Just my opinion.
Go vote. Well, it is my opinion that you absolutely should go vote. And if you're not going to vote, I suppose I do understand, especially for people who are older, or people who might be concerned, there is such a thing as absentee ballots, and I know.
However, I did just look it up because I was wondering if I qualified for an absentee ballot. I do not qualify for an absentee ballot in Texas.
Yeah.
The reasonings behind it are you have to have like a documented health problem that would put you at risk. You have to be over 65, in the military, or you have to be out of the county on that day and receiving your mail somewhere else. So even though I would technically be in Dallas County on voting day, on election day, I'm not receiving my mail anywhere outside of that.
Yeah.
So it was kind of weird. I did not qualify.
So there is no what's it called? It's just like no reason or something like that. There's it's like no reason voting or no.
Yeah.
Because I know that they're doing that in a lot of states.
I don't know that Texas is though.
I don't think they are. So the point is, if you're going to vote in Texas, go vote.
Yeah.
Right. Go to the poll.
It's easy to look up where you can vote and when you can vote early. It's like 12 hours each day at like 25 different places, at least within Collin County.
Also, I like the fact that you use the term civic duty, right? It is your duty to vote. So a lot of people think about voting as a right, right? And it is your right.
It
right?
is.
It is your right. You do have a right to vote, and it is a good thing. But with rights come responsibilities. Voting is very much a responsibility,
yes.
Right? Making sure that you, and again, this is why I always advocate for educating yourself and making sure that you know who you're voting for, right? Because it is your responsibility as a citizen, right? As a citizen who has a contractual relationship with the government to a certain extent, right? Citizenship is to a certain extent a contractual relationship with the government. It is your responsibility to make sure that your voice is being heard, right? You hear the term, and I can't say this on the podcast, but you hear it starts very close to this. Don't vote, don't complain, right?
Yeah.
Don't vote, don't complain, right? If you have issues, then you need to go vote. You need to show up and you need to be there. And I think that this is a great example, right? People say, well, voter fraud doesn't happen. Well, it kind of does. You know, you got a guy probably serving time in prison at this point because he was caught with voter fraud.
Really wanted to be mayor.
Mayor of Carrollton, man.
He's really concerned.
Mayor of Carrollton takes you to different places. I mean, for example, right now in the 24th district, one of the candidates is a mayor, right? This is the mayor of Irving. Who is running for the state representative. So, and that's another thing that's important to note about your local elections is that the people that you're voting for in your local elections will at some point
show up somewhere else.
Yeah. They'll be in the state legislature, and from there you might go to the national legislature or the governorship, and from there you're talking about the White House, right? It's not everybody is Donald Trump who just makes $1 billion and says I'll run for president.
I'm shocked.
A lot of people. Dude, that was a hot one for sure.
It's just like, oh, you're running for president?
A lot of people, most people work their way up, and they started at the local level. So your local vote does matter in that respect also.
Absolutely.
Hayden, how long have we gone, man? What are we looking at? What are we looking at time-wise?
35 on this take.
35? It's 2:35?
No, 35 minutes.
35 minutes on this take?
3:25 p.m.
Okay, cool. So it is about that time. I did have one other election. Do you want to do the other election? Or you want to?
Sure.
All right, cool. Let's do one more election. I'll be really quick on this one. This is also in Carrollton, and this is something that probably won't show up on your federal ballot, but it is there. I really do think you should investigate where these votes are taking place and go vote for yourself. You've got the second place, right? Place number 2 on Carrollton City Council. And there are a couple of places on the Carrollton City Council that are up for election at this point. Also, it's important to investigate what city council positions are up for a vote in your particular city, and go vote for those as well. But right now, we've got 3 candidates that are running for the City Council of Carrollton. And again, we get the really cool names here. Number 1, Chris Axberg. Right now, Axe is his
Mouthful.
Axe is his name is Chris Axberg, but he calls himself Axe. Chris the Axe Axberg.
Does he have an axe on his?
He does, right? His sign's got a big old axe on it. You're not gonna miss the Axe's signs. Chris the Axe Axberg, okay? Priority, and now this is a really cool thing, because this election, and we'll see here in a second. There are differences, obviously, but because we're running for a small suburb in Texas, the differences between the candidates are far more nuanced than they are at the national level, right? Mm-hmm. Because your set of voters is much smaller. So the issues are going to overlap a lot more. Priority issues for Chris the Axberg. COVID-19, right? Number 1. He says that's the number 1 thing affecting our community right now is COVID-19. Business and community development. So again, he is very much along the lines of Kevin Falconer, where he is wanting to increase the appeal of Carrollton. He's wanting to build and expand and develop, and there's been a lot of good developments in the Carrollton area. I know that. And the other one is global outreach. So one of the cool things about the Axe is that he works as an executive for a digital marketing firm. And he works with global companies, right? So he's worked with global companies like Yahoo, McAfee, and something called the South China Morning Post, which I'm assuming is a newspaper in China. But the fact is, he has an international presence, right? He's worked in places like Hong Kong and Singapore. The dude seems like a mogul. He really is a very public presence, and he wants Carrollton to have a global appeal. He wants to appeal to international businesses and get them to invest in Carrollton. I put that on there because I think I've never heard that from a candidate. What are your thoughts on that, Jordan?
I'm just like, my mind is boggled that when I think of Carrollton, I do not think of global appeal. That's just... I don't know, like somebody in South China that's like, oh yes, we need to go to Carrollton. Let's go to Carrollton. Let's put our business in Carrollton, Texas. Like, it's just not to say anything bad about Carrollton. Yeah. I like Carrollton. It's just...
I will tell you this.
That's just not what I would have ever thought.
I will tell you this. I know people who are internationals, right, who know where Arlington, Texas is.
The Rangers are there.
Yeah, Arlington, Texas. That's the Rangers. That's the Cowboys, right?
Six Flags.
Yeah, Six Flags, right? So that's his ambition.
Okay,
is that somebody
it.
international because of international business,
sure,
or because of the fact that we just have such a presence on the stage that we are recognized.
I guess that's definitely fair. I mean, you got Plano, right? Headquarters Drive. You've got all those big national headquarters are here in the area. State Farm and I don't know what other, USAA, some other ones.
Yep.
Like, I guess that's fair. Just never would have crossed my mind.
Yeah. So his endorsements. He's endorsed by the Knights of Columbus.
Oh yes.
Which is awesome. That is a great organization name, right? And I know that they're a popular organization, but I just really love to say Knights of Columbus, right? Knights of Columbus. The Lions Club International is endorsing. This is endorsements or affiliations, so it's not necessarily an endorsement, but it is an organization with which this candidate is affiliated. And the Sons of American Legion. So again, we're seeing a very Chris the Axberg is Catholic. We're seeing a very Catholic.
That explains the Knights of Columbus.
Yes, we're seeing a very Catholic presence in his affiliations. That brings with it certain family values to his platform. He is, he's got a big stance on religious liberty and things of that nature. So you're getting that's what you're getting with the Axe, right? And so those are his big things. Now we're going to talk about the other challenger. Adam Poulter is his name. Now Adam Poulter is an interesting guy. Chris the Axberg has a very he's got a big axe on his sign, right? He's a very open and I don't want to use the term flamboyant, but he's a very present. He's a bold candidate, right? And you just look at him and you can see like he's very sort of political. Adam Poulter is far more reserved, right? His signs aren't quite as recognizable, and if you look at his images, right, he seems very terse, very very sort of, I'm going to get the job done.
Refined.
Right. He's very refined, right? He seems very military, which is, of course, a big part of his platform. He has military service. He served from 1987 to 1991. He was involved in Desert Storm. So you're getting a military man here. Priority issues. Public transportation. Expanding public transportation in the city of Carrollton. The environment, specifically the expansion of the Camelot landfill, which is a major landfill that's there in Carrollton. As somebody, I can tell you, I lived in an apartment complex several years back. Me and some friends of mine lived in an apartment complex that backed up to what we called Trash Mountain, which was the Camelot landfill. He has actually lobbied Texas Commission of Environmental Quality against the expansion of the landfill. So environment is a big part of his platform. And here's a nice one. We have a couple of friends that this might be really appealing to. IT management is number 3 issue as far as his priority issues is IT management. So apparently, I don't know if you know this, but we had a big ransomware attack in the city of Carrollton. So the city of Carrollton's IT servers had a big ransomware attack. Recently, yeah, back in 2019, shut down the IT infrastructure for the entire city.
Wow.
So Mr. Poulter's going to get in there. He's going to fix that, which is good because that's what he does. He's an IT guy. That's his job right now.
Okay.
He works in IT, and so he's going to help protect our IT infrastructure security in Carrollton. Those are his big issues. So his career, endorsements and affiliations, couldn't really find anything on anyone who specifically endorses him. Poulter doesn't have anything religious in nature, so you're not going to get the Knights of Columbus kind of stuff on his platform. He's a very about the issues, by the book kind of a guy. Career, military service from 1987 to 1991. He served on the Parks and Rec board, right? He served 2 years on the Carrollton Parks board. So he's a Parks and Rec guy. His expressions look very Swanson-esque. So, right. But, he, again, fought to preserve, the, parkland, and, he fought for the preservation of the Indian Creek Golf Course, which is a golf course down by 35. And he is an animal welfare activist, right? I have no idea any policy prescriptions that he's applied on or that he advocates for as far as that's concerned, but that is something that is big and prominent on his platform, right? So that is Adam Poulter, right? Thoughts on Mr. Poulter? Anything sticking out at you like the global outreach did for the Axe?
No, I mean, sounds like a great guy.
IT
what branch
management.
of the military was he in?
He was in the Army.
Oh.
He was in Army. Yeah, he was in Army. Oh, okay. Well,
Good for him.
There went Jordan's vote.
No. I love our military. Just, go Navy.
All right, go Navy, beat Army.
Always.
That's right out of Hormann's mouth. Okay. IT management I thought was a really interesting part of his platform. I've never never saw global outreach on.
I mean, it makes sense though. And it also seems like it would be very pertinent to Carrollton and considering that. I mean, I guess if you live in Carrollton, you probably knew that.
People that care will vote on stuff like
that happened.
Let's talk about our incumbent. Right, the current holder of City Council Place number 2, who is running for re-election, Mike Hennifer. Is his name.
That's unfortunate.
Jennifer with a J. Mike Hennifer. Priority issues: public safety and fiscal responsibility. Right? Where did money go? That is Mike Hennifer's number 2 issue. Right? So he is he's endorsed by all sorts of police and law enforcement individuals. He's endorsed by several judges. He's endorsed by a lot of public officials, which, you've been serving as Carrollton City Council member. You're probably going to get some endorsements, right? So his endorsement is significantly larger. Now, the public endorsements, right? So you've got the endorsements of private individuals. Public endorsements. NRA. He's got the NRA endorsement. He also has the Texas Rifle Association, so the TRA's endorsement, and Texas Right to Life. Endorses Mr. Hennifer, right? So he is very much on that vein of things, right? So he's got those endorsements there. Career, president of Corporate USA Asset Management Leasing Investments. This is a real estate guy. So again, real estate always kind of perks my attention. working in real estate myself. This dude has started and maintained 3 separate real estate businesses.
Wow.
From brokerages to investment firms. Dude knows his stuff when it comes to managing and running a business, right? He established these businesses in 1991, and I think 2 of them are actually still present. So he's a business guy. He has served as on the bishopric for 7 years. He's the bishopric of a 400-member Carrollton congregation of the Church of Jesus Christ of Latter-day Saints. So he is a Mormon bishop. With that comes all of the, I mean, if you don't know about what a Mormon is going to bring as far as platform, go look at Mitt Romney, right? So that's, he's a little Romney.
They're really friendly.
They're very friendly people. They're also very family oriented.
Straight from the words of Senator Mike Lee today.
Yeah, they're very friendly. They're very friendly people, but they also bring a very family oriented platform, religious liberty oriented platform. All of that is what you're going to see from Mr. Mike Hennifer. He is your incumbent. He is the man to beat. Whether the Axe or Mr. Poulter are going to beat him, we will soon find out. Now, that is, if you are in the Carrollton area, please, friends, go vote, right? Make your voice heard in the elections that actually matter. Well, Jordan, any final thoughts before we leave these fine people?
I just got some research to do tonight.
Go research, go vote, friends, right? That as always is going to be my closing thoughts. Make sure that you are well informed. Make sure that you vote, but remember, voting is both a right and a duty. It is both a right and a responsibility. Treat it as such, because it is a wonderful, wonderful country that we live in, where we don't just get to vote who runs the country, but we get to vote on who runs our local areas, who runs our lives. Nowhere in the world is there such a privilege that's being extended in the same way that we have it here in the great United States of America. So please take advantage of that, but do so as an informed citizen. Do so as your civic duty. And remember, friends, until next time, the federal might be sexy, but your local matters.